Good morning, everyone. We're just going through some technical issues right now. And I wanted to let you know that we are working on those and we will be starting shortly. Welcome, everyone. Thank you for joining. Thank you so much for joining us today. Hopefully everyone can hear me just fine. And again, we had some technical difficulties early this morning. So I hope everyone is able to hear me just fine and see my slide presentation as well. And I'll be joining you here shortly to start the presentation. Good morning. I wanted to make sure that my audio was working just fine, so I'm just going to touch base here with Mike Kitzman. Are you there? Can you hear me okay?
Yes, I can. Your audio is loud and clear.
Hi, this is Mike Weber from Molina.
Mike,
Can you
are
hear
you
me
able
okay?
to hear me okay?
Yeah,
Yes,
I can hear you.
We can hear both, everyone okay.
Good morning. Mike, are you able to hear me okay?
Yes,
Perfect. Thank you so much for that. And I also wanted to double check with you, Mike. Can you see my screen?
I can.
Wonderful. We did have a couple of technical difficulties this morning, and so hopefully we will work through those and get those worked out as we go along. We will be having a couple of presenters today, and I would ask that the MCOs would share their screens when I'm done with my presentation. And so I wanted to go through that with you folks from Molina. If when I am presenting you, if you could share your screen when it is your turn. And then of course, Iowa Total Care and AmeriGroup, if you could share your screen when it is your turn. All right. Good morning, everyone. I wanted to go ahead and just make sure that everybody was on board with us. Hopefully we have a lot of you folks on today that were not able to attend yesterday. And I do want to, clear up some information from yesterday's training. We were at Cedar Rapids, and thank you for all of you that did attend in Cedar Rapids yesterday. Apparently there was some, again, some technical difficulties with the registration and those types of things, which could have been frustrating for a lot of you folks that did register for that as well. And so wanted to address that right off the bat for everyone. So hopefully today we will have smooth sailing for this morning's meeting. We do have one again this afternoon that will be held from 1 to 5. And then tomorrow we will be in Mason City. Now in Mason City, it starts at 8 a.m. at the conference center at the college there at Nyack. And then 8 a.m. to 12 is that one. And then the next one will be from 1 to 5 tomorrow afternoon in Mason City. For the following week, we do have our first presentation that will be held at the Sioux City Convention Center on Tuesday from 8 to 12 is the first session. And for the second session, it will be 1 to 5. Then on Wednesday, we will be at the the Wallace Building here in Des Moines. And it will be the same time frame, but that will be on Wednesday. And then another Zoom presentation will be held on Thursday. So I'm going to take a brief moment here just to make sure that everybody gets signed in. So I appreciate your patience. Thank you. It looks like we do have a couple of folks that are asking some questions in our chat box. So throughout the presentation, if you did want to put some notes in the chat box, and our team will be monitoring those messages throughout the presentation today. And I did want to let us know that some of the slides, Julie, were not able to be changed for today's presentation this morning, but we'll get to those this afternoon. So there's a couple of slides, Julie, that was not able to be changed at this point. So I did want to let Julie know that while we're on the line here. So let's go ahead and get started, everyone. And hopefully, if you do have any questions throughout the presentation, you can put those in the chat. We do hope that that you are having a wonderful day. Yesterday was bright and sunny. And my name is Maria James, specialist with Iowa Medicaid. And I do want to thank you for taking your valuable time today to attend this training. And we appreciate all of your hard work and dedication to all of our members over the last couple of years. We've all had our challenges. And to address those challenges, Iowa Medicaid is doing everything we can to work with you, to help you out throughout this process, and to help ultimately our members as well. Now, in response to you as our providers, we've made it our goal to assist you. Therefore, the presentation today will have numerous changes that are happening. And the first one that you'll see is in our logo, State of Iowa Department of Health and Human Services. And we'll be addressing a little bit of that up in the upcoming slides. Now, Julie will be talking about our town halls here in a little bit, as well as we'll have some additional information on those town halls.
Maria,
Yes.
if you're sharing a screen, we cannot see it.
Well, thank you for that. I appreciate it. So I'm going to stop this.
Now you're muted.
All right. Are we all together now?
Maria, I don't think we're just seeing your screen, but not the document that you're trying to share.
Love to work through these technical difficulties. Thanks for all of that information. Let's see. Julie, are you able to see that?
Yep, you've got the list of presenters up there.
Wonderful. I do want to might want to make some changes to this as well. And we do have Paula Motzinger and some additional staff from Iowa Medicaid that will be helping us through the presentation today, as well as Julie Lovelady, Sean Bagnowski, Lindsay Paulson. And for Molina Healthcare, they have been able to join us today as well. And then for Iowa Total Care and AmeriGroup, they will have their introductions as well. So let's go ahead and get this started. So I did want to start out our presentations today by introducing you to Molina Healthcare from Julie Lovelady and Paula Motzinger. Julie, are you able to go ahead and get started with your presentation on Molina?
Yes, I'm ready.
Thank you.
Good morning. I am Julie Lovelady, Deputy Medicaid Director. And then with me this morning, I have Rebecca Curtis. And Rebecca is our Bureau Chief for Quality, Innovation, and Medical Policy here at Medicaid. So on behalf of Medicaid Director Liz Matney and the entire Medicaid team, we want to thank you for taking time out of your busy schedules to join us for the 2022 Iowa Medicaid Annual Provider Training. So I'm going to start off with a couple of opening remarks, and then I'm going to turn it over to the dedicated Medicaid Provider Services team to get the morning going. First, As most of you have heard, the Iowa Department of Human Services announced on August 31st the intent to award contracts to AmeriGroup Iowa and Molina Healthcare of Iowa. Iowa Total Care will also continue to serve Iowans in the Iowa Medicaid program. Molina will begin providing services in July of 2023. And Iowa Medicaid will work closely with Molina as they stand up their operations in Iowa, and we will communicate with members and providers as this new option for healthcare coverage becomes available. As we onboard Molina, continuity of care, provider payment systems, and member choice are the utmost important, and we're engaged in planning to ensure all efforts are made to achieve positive results in these areas. There'll be much more information to come in the next few weeks. Our Medicaid program is focused on improving the lives of our members and is dedicated to goals of identifying and addressing gaps in care, focusing on improved outcomes, improving infrastructure and operations, and of course, to promote transparency. We have a number of very big initiatives in the hopper, including a community-based service evaluation to look at how we serve Iowans in the disability, the behavioral health, and the aging systems. A strong focus on initiatives targeted at maternal and child health, better outcomes for our foster care children receiving services through Medicaid, process improvements aimed at changing how Medicaid does business, leveraging our health and human services alignment to infuse the public health lens in all that we do. We need as many partners as possible to help us accomplish these goals, whether they are healthcare providers, MCOs, or community stakeholders. These managed care contracts are a very important and large book of work, and contract compliance is critical, and our managed care partners are expected to do business in line with the state's vision for the program. But it is more than just compliance. At the end of the day, this is a program that people depend on, and we need partners at the table who understand this responsibility and have that in mind in all that they do. So at Medicaid, we're doing a number of things. We're trying to listen to our stakeholders and with our providers and members and stakeholders. We want to make sure that we hear and respond to your feedback. It's incredibly important to us. As you know, Medicaid Director Liz Matney started doing monthly town halls along with her leadership team. It's been extremely useful to hear directly from members and providers about what Medicaid is doing right and what are some opportunities for improvement. Every town hall we share Medicaid updates. These town halls are the last Thursday of every month, and we share updates on what's happened in the past month. And we also leave an open period to hear directly from providers and members. So I encourage you, if you have not attended any of those town halls, to certainly start attending those town halls to learn the latest information that Medicaid has to share, as well as to share your thoughts on things that are working well and things that need improvement. The feedback that we've received, especially in 2021 and 2022, are reflected in the changes in the new contracts, which really prioritize program improvements and better outcomes for those we serve. We had a targeted town hall meeting last week, September 8th, to discuss the MCO intent to award, and more importantly, to hear from members and providers on areas that they want us to be mindful of during onboarding. And we received some really good feedback from some of our members and providers on some opportunities to really be mindful of during onboarding. And we look forward to any additional ones that any of you may have for us as well. We're confident in our process to bring Molina into the Medicaid program and simultaneously improve overall. And as I mentioned earlier, we've made some important updates to our managed care contracts based on experience and feedback from our providers and members, including enhanced Iowa-specific long-term services and supports training for our managed care staff, additional readiness review requirements, which includes end-to-end testing with providers. And this is another area that I want to put a little plug out there, that it is really critically important that we get all our providers from all of the different provider groups to do end-to-end testing with our new MCO to really smooth the process along. So I know that Melina will probably talk about that in their discussion as well this morning, but I did want to put a plug out there that people need to start thinking about and planning for doing that testing end-to-end with Melina. Coordinated messaging and file transports or transfers to support continuity of care. We have plenty of time for the readiness review and network adequacy evaluation. Community-based case management. We strengthened requirements for external communication and coordination to ensure that there's adequate and timely collaboration and record sharing during member transitions. Changes to improve provider enrollment with some tighter timeframes, and added some non-emergency medical transportation standards. So Rebecca and I will be available. We'll be kind of in and out throughout the day, but when you get to questions, the provider services team should be able to assist you, and Rebecca and I will be able to assist as much as we can as well. So with that, I will turn it back over to Maria. Thank you.
Thank you, Julie, for that. I appreciate it very much on the update on Molina Healthcare and some other things that we do have going on at Iowa Medicaid. And I'd like to just briefly go through, I want to make sure that you keep in mind that this training is intended to be addressed to all provider types. Some sections are more specific to certain providers, and you'll find a plethora of resources and contacts throughout this presentation, which you can find on IME's website. The training is being recorded and will be placed onto IME's website for future use. And I've had a couple of folks ask if they can print it off. If that is something that you would like to do, you certainly can do that. But the final presentations and any changes that are made to the presentations will be available after all of the trainings are done. So there is a couple of things that will be changed on the slides that we have for Iowa Medicaid prior to posting that, to ensure for accuracy and clarity. And so we do have a lot of content to cover, as you can see. And so I'm not going to read through each one of these, but did want to let you know that throughout this presentation, we will have several speakers presenting, and we'll entertain questions throughout the entire presentation. And again, folks will be monitoring that from not only our MCOs, but from Iowa Medicaid as well. So we're going to go ahead and get started with the remittance advice, or RA. And throughout the presentation, I will do my best that I possibly can do to go through what each initials do mean. Many of you know what each initials mean, but I want to make sure that you do have that information as well. So regarding remittance advice, check your fee schedule, check your fee for service, RA, for credit balance. So again, check your fee for service, RA, for a credit balance. Now, a credit balance is when you have a negative balance, which is an outstanding overpayment. You must address the credit balance within 30 days of the published RA. Now, under Iowa Code, a provider's failure to remedy the outstanding overpayments may be subject to additional administrative actions by the department, including but not limited to payment suspension or suspension from participation of federal and state programs. Now, a suspension from participation that is published in the Federal Data Exchange Registry will preclude a provider from participation in state and federal programs such as Medicare and other states' Medicaid programs. Promptly remedy any credit balances or outstanding overpayment with Iowa Medicaid to prevent further administrative action by the department. We've put together some helpful tips for you when reading your RA. Promptly review and read your RA for the detailed information pertaining to payments for made submitted claims. Now, contact provider services to receive assistance in interpreting that RA. And again, throughout this presentation, you will see numerous references of phone numbers, emails, clickable links within our presentation, and some additional resources for you. And I have included some here. Now, a resource to interpret the RA adjustment code reasons can be found at claims, forms, and instructions in Iowa Department of Human Services. And here is the Iowa Medicaid fee link. Now, if you do not agree with the credit balance, dispute it within 30 days with Iowa Medicaid providers services. Let's go ahead and jump right into the eligibility recovery claim submission guidance. We're going to discuss what to do when a member's status changes from eligible to retro ineligible with an MCO. You will receive recovery letters from the MCO. And again, I do want to alert you to a little difference in our terminology as well. MCO, Managed Care Organization, and MCE, Managed Care Entity, are interchangeable in our language. So I did want to alert you to that as well. So when you do see that on our screens, or I use that verbiage as well. Now, if a recipient is deemed ineligible for medical assistance following the delivery of care or service by a provider, and an administrative action to recover overpayment to the provider based solely on the grounds of such recipient's ineligibility, the department acting as a state Medicaid agency shall reimburse the provider for any recoupment of an overpayment using state-only funds for care or services delivered if conditions are met. Now, the managed care entity will send out letters that to announce and let you know of this retroactive recovery. And providers will receive those recovery letters requesting payment for those services during the period a member was inactive and services were provided. Now, providers are required to verify that they checked eligibility and at the time of services were delivered. And this verification must accompany the request. And here is an email that you'll see throughout the presentation for IME provider services. Here are the steps to go through this process: review, bill, and appeal. Now, the department will review the member's eligibility status and advise the provider to pursue one of the following: bill Medicaid for non-active members for cases where the member has transitioned to ineligible, or appeal the recoupment with the managed care entity in situations where the reason for the denial is anything but loss of eligibility. Provider services verifies retro ineligibility recoveries, and if eligibility was updated, submission details will be provided. If recovery appears to be in error, the provider will be directed back to the MCE to appeal by a process noted in the recovery letter. Providers will resubmit claims directly to Iowa Medicaid via Provider Inquiry Form 470-3744. Include the Provider Inquiry Form, which is the MCE recoupment letter, Medicaid ELVS or web portal verification of eligibility for dates of service, and any other pertinent claim documentation for each date of service for the affected members. If the member has been fully verified before service is rendered, provider services will need you to fill out this form and the recoupment letters as well. Now, in order to appeal, providers will need to submit an appeal with the MCE that issued the payment recovery. And again, our contact information. Not only do you have to verify the information with the IME or Iowa Medicaid, you must also contact an appeal with your MCE. Always talk to your MCE provider representative or provider experience manager regarding this issue to ensure that you are following the MCE guidelines regarding recoupments. You have 365 days from the date of the recoupment letter. So it is not the date that you received the letter, it is from the date that is listed on the recoupment letter. Again, the date that you have listed on the letter itself, not the date that you received it. Now, we did have a few questions yesterday regarding this particular topic. If you do have specific or targeted questions that pertain only to you, please do contact your MCE or do contact Iowa Provider Services as well. The reason why I say that is because some are more detailed than others. There are some that are pretty straightforward that we can help answer. That may be a generic question that you can put out on our presentation today in the contacts on the side. However, if they are targeted or specific, or you've been struggling for a while, I would highly suggest you contact your managed care organization or IME provider services. Let's move on to our famous top 10 denial reasons for fee for service. You have 365 days from the date. I apologize. Again, for any MCO denial reasons, please speak with your MCO provider representative if you have questions about the MCE claim denial. If you have questions regarding fee-for-service claim denials, please contact IME Provider Services. Here are those 10. Code 467. The recipient is enrolled in a Medicaid, HMO, or MCE. The service date is not covered under fee-for-service Medicaid. The HMO or MCE must be billed. Number 2, 101, code number 101. This is an exact duplicate of a previously paid claim. And again, these are the most common denial types. So every year we want to bring these to your attention so that it makes your job a little bit easier when doing billing to understand that these are the top 10 and how to interpret those claim denials. So for code 132, amount charged is missing. For 275, service not covered for recipient. The state eligibility file shows limited or no Medicaid eligibility for that date of service. And 367, the procedure code billed is not valid for the provider billing the service. In other words, it does not match your taxonomy code as well. And for code 368, again, it is an invalid procedure code. The taxonomy does not reflect this type of claim submission code. This provider, AFT type, provider specialty, may not bill for this service. Code 311, recipient ineligible service not covered. The recipient has limited benefits or benefit restrictions and is not eligible for this service. Code 915, medically needy, patient has not met the spend down requirements. And for code 237, this service is considered not a Medicare crossover covered service. The claim did not meet Medicaid payment criteria for direct Medicaid billing. And for code 317, and our last one of our top 10, the provider charge record not found, missing or incomplete invalid number of covered days during the billing period. Submission or billing errors, which is needed for adjudication, do not use this code for claims, attachments, other documentation, or at least one remark code must be provided. Moving right on into our third-party liability. TPL. Now, the informational letter 2131 will give you all of the information that you need for third-party liability, as well as additional information letters that you will find out on our website. So if you have not signed up for informational letters, I would suggest going out to our website to sign up for those. And the reason for the informational letters is to provide you with the most recent and current information that we have at Iowa Medicaid. And there are different types of informational letters that you can sign up for as well. Again, going back to third-party liability. So under the informational letter 2131, we wanted to point out a couple of things that have a tendency to be repeated by some of the providers. And so we want to make sure that we're being very clear on what our expectations are regarding third-party liability. ELS is no longer provides third-party liability verification for members assigned to a managed care entity or dental pre-ambulatory health plan, PAHP. The managed care entities and the dental PAHPs will provide verified third-party liability information for their members. Providers should report TPL leads or changes for the member's health insurance or dental coverage to the member's assigned MCE or dental PAHP. Now, Iowa Medicaid is not the source of truth for members assigned to a managed care entity. Providers need to go through the MCE's dental plans to verify the coverage and report changes to them, as previously stated. Now, for fee-for-service or FFS member, the third-party liability verification continue to use eligibility and verification information system, ELS. The third-party liability leads or changes for members for fee-for-service should be reported using Form 4705445, Insurance Update Fee-for-Service Members. Let's jump right on into the Outpatient Code Editor, or OCE. Why am I getting claim denials related to OCE edits? Again, we've put this PowerPoint presentation together for you because we do have frequent questions regarding the OCE denials that you are receiving. The IME nor the MCO does not create or maintain the OCE. Therefore, any claim denials in regards to the OCE cannot be changed by IME or the MCOs. Every claim will have an explanation of the OCE denial. Now, to understand the OCE denials, it can be confusing. And so we do have some contact information in the subsequent presentation here. But the OCE edits identify incorrect and inappropriate coding of these claims. In some instances, it denies a claim in its entirety or certain problematic lines. Now, the OCE editing system is created and maintained by the CMS to handle outpatient facility claims. The circumstances as indicated by the specific OCE edit, the determination is to deny an entire claim. So don't be surprised when it does. That is not an error, even when one line is problematic. This is sometimes referred to as the return to provider, RTP. While the claim is not rejected at EDI, it's accepted and then denied by the claim processing system. The claim line with the error is noted at the bottom of the EOB with the line error denoted. Here is how to read a remit when a claim is denied in its entirety for one or more problematic lines. Again, an important note, the claim line with a critical billing error will have a specific indication and unique X denial code pointing to the problem. As an example, code not recognized by outpatient prospective payment ops, payment system, also called ops. A claim line is denied for OCE edit number 62. For example, code not recognized by ops. Alternative code for same service may be available. This line is denied with X code H47, code not recognized by ops. Now the P60 denials in the majority of cases will not be eligible for reprocessing through claims reconsiderations initiated by a provider unless there is an explicit medical necessity or a retroactive type of hospital outpatient update. Now, this means the action that can be taken by a provider is to submit a corrected claim utilizing the above mentioned resources. Another example, P60 denial is not a covered benefit denial. In this instance, if there are no other errors on the claim, each remaining claim line would be denied with the explanation code P60, claim returned to provider for correction. Now, as a reminder upon the CMS OCE editing, even if there is no error or issue with the remaining lines, if the OCE edit occurs anywhere on the claim, indicates an entire claim denial, return to provider, these lines must also be denied on this guidance. Now, the MCE employees by law may not explicitly advise a provider on which codes or other parameters to bill with. Now, it is recommended that you evaluate all of your resources available to you as a provider entity, including contracts, CMS, or state guidance. Again, as promised, I do have some additional resources for you. Again, these can be found on our website. And you can also look up any of the topics contained today on our website under our Provider Services tab. We're going to move into, excuse me, to the electronic visit verification. This system helps provide real-time alerts when a provider is late or misses medically necessary services. What is EVV? It is a federally mandated system to be used to monitor the delivery and utilization of personal care and home health services in non-traditional settings. It provides verification of the visit with the location information and a timestamp. It is used to ensure the quality and program integrity. It records such information as time of service, person receiving the service, date of service, and the location of service. It records the time of service when it begins as well as when it ends. Now, what's in it for a provider? Faster medical billing and payments due to eliminated paperwork and reduced errors, better scheduling and communication, and reduced fraud does help with audits as well. Now, EVV is currently required for the following service codes provided through unmanaged care entity. Attendant care services, S5125, homemaker, S5130, homemaker per diem is S5131, and personal care services, T1019. Now, regarding staff employed as shift workers by the ALF-RCF, it is the state's decision whether to require EVV for these employees. Now, the 15-minute units in which home and community-based services are built to comply with state efforts to track service providers, you can find more information on IL 2239. Failure to comply with the attestation requirement may result in disenrollment, sanction, termination, or recoupment of funds and/or liability under Code Chapter 685 or other federal and state laws and regulations. Now, for community-based providers who are not regularly scheduled shift staff of the ALF-RCF, the delivery of service would require an in-home visit. Therefore, the state will track personal care service provisions according to the EVV requirements as listed in the 21st Century Cares Act. Now, on this next page, this is the website for CareBridge, and this is their homepage for CareBridge. CareBridge is our vendor with Iowa Medicaid to deliver and monitor and help with the EVV for our providers. So again, this is a great page to go visit. They do have additional training on their website. They have a lot of contact information. And as you can see at the bottom of this website, there are different tabs for different types of providers as well. Again, we do have a great deal of information, resources available for you, not only on our website, but on CareBridge as well. Here are some frequently asked questions. Now, I've only pulled a couple from our website, and CareBridge does have this information as well. Anytime that you do have a question, we want to make sure that we address those questions immediately. And it is my experience that CareBridge is very good about responding to those questions, any technical difficulties as well. Our first question is, do consumer choice option or CCO employees still submit paper timesheets? What if a CCO member has consumer directed attended care or CDAC and supported community living SEL on their services? Do they have to submit a paper timesheet for SEL and then EVV for CDAC? The CCO employees that provide personal care may use the EVV for personal care services in place of a paper timesheet. For services that are not personal care services, CCO employees will use current service documentation methods. Fee-for-service CCO employees will continue to use the paper timesheets for all services. Next question. I work with my daughter 24/7. If I clock in for a 3-hour day shift, how would I show that I prepared three meals? Would I need to clock in on a split shift? The agency is not exempting live-in caregivers from use of the EVV system for submitting service documentation requirements. All individual consumer-directed attendant care or ICDAC and CCO caregivers must use the EVV system to check in and out of EVV for required codes. There might be situations in which the caregiver is not able to clock in and out when the shift occurs. They would need to add a manual record for the units of services provided. The number of minutes of services provided throughout the day will be totaled each day and rounded to the nearest unit. And let's go through that in a little bit more detail. CDAC is billable in 15-minute units for a unit of service that is 7 minutes or less. Round down to the nearest 15-minute unit. For a unit of service that is 8 to 14 minutes, round up to the nearest 15-minute unit. For example, 37 minutes would be rounded down to 30 minutes and billed as 2 15-minute units. 38 minutes would be rounded up to 45 minutes and billed as 3 15-minute units. Next question, how should the signature be handled if the patient is not able to sign their name? What if the client refuses to sign the attestation? If a member refuses or is unable to sign, the caregiver will have reasons to choose from the mobile application before checking out to indicate why the member did not or was unable to sign. And again, additional resource information for you. Let's go on into the next slide, and that would be under HCBS, the State Transition Plan. The Iowa legislature has appropriated funds to be evaluated annually for technical assistance and statewide computer-based training to long-term services and support, LTSS service providers. And most recently, we have had a presentation specifically designated for this state transition plan. So I'm just going to provide just a few highlights to that. Now, any training that is held with Iowa Medicaid can be found on our website as well. The benefits to you as a provider, trainings are relevant to Iowa rules and regulations, CMS standards, and HCBS philosophy. More opportunities for providers to acquire well-trained, competent, direct support professionals with measured core competency. And I know we all in the United States have been suffering from having a lack of employees, number one, and number two, qualified employees. And this is one way that we can help to address that issue. Now, we also have improved access to trainings and information pertinent to member care. Competency-based learning with objectives to ensure training topics are relevant to and useful to the agency's needs. Regarding competency-based training and technical assistance, it is provided free to our providers. It also helps to generate positive outcomes for members and for providers. More benefits to assist providers to understand compliance with state and federal regulations. As we all know, these can be extremely complicated and confusing. It is also to increase competency in direct support positions and to increase the access to information statewide for waiver and habilitation providers only. The following provider types have been appropriated funds to be evaluated annually for technical assistance and computer-based training for the following provider types. Additional programs, hospice services, MFP or money follows the program and follows the person, I apologize, and private duty nursing personal cares program of all-inclusive care for the elderly, the PACE program, for example, home health services, management. Here are the links to the training and technical assistance program, and archive trainings can be found here. This falls right into our next topic, which is the American Rescue Plan Act of 2021, ARPA. On March 11th, 2021, President Joe Biden signed the American Rescue Plan Act. Section 9817 of the ARPA provides qualifying states, such as Iowa, with a temporary 10 percentage point increase to federal medical assistance percentage, FMAP, for certain Medicaid expenditures for HCBS programs. This is the latest grant application information. Please refer to Iowa Medicaid's website for ARPA for all of the details and instructions. Now, we are currently in our fourth application period for the ARPA. You're going to hear me say this a couple of times, but it did begin on this application period for September 1st through the end of business days on September the 22nd. So if you are interested in and would qualify for the ARPA grant, please get your application in as soon as possible. Now, those providers that are eligible for this period are the 1915C HCBS waiver providers, including case management and consumer choice option employees. Home health agencies delivering HCBS waiver services, personal care and private duty nursing, targeted case management, and the following rehabilitative service providers. The Medicaid cost report establishes the allowable cost to provide a unit of service for individuals receiving the service regardless of payer. All ARPA HCBS fund recipients must maintain appropriate records and cost documentation. Funds received from the ARPA grant listed above are not intended to increase reported services costs of the agencies receiving those funds. Now, to be eligible for grant funds, you must meet the following 3 requirements. You must have billed a managed care organization or fee-for-service Medicaid for eligible services provided between July 1st, 2020 and July 30th, 2021. You must have continued to provide patient care after April 1st, 2021. And you may not have permanently ceased providing patient care directly or indirectly. Funds received from the ARPA grant project shall be reported on Schedule A of the HCBS cost report. Now, with respect to Medicare, any state Medicaid program and any federal healthcare program, the recipient is not suspended or excluded from participation, suspended from receiving payments, under any other sanction or penalty, and you may not have permanently ceased providing patient care directly or indirectly. Agency providers enrolled under multiple NPIs or National Provider Identifiers for eligible HCBS should list those NPIs and their corresponding pay and legacy numbers on that application. You should not submit more than 1 application. It will be rejected. So only 1 application will be accepted per provider. Now for ICDAC or Individual Consumer Directed Attended Care, providers will enter their atypical NPI assigned by Iowa Medicaid on the application form. And again, this number begins with XO. Here are the dates for this 4th application period. Once all provider applicants' eligibility has been verified, Iowa Medicaid will determine the amount of grant funds to be distributed to agency providers for each FTE or full-time employee. There are several parts to your application. If you do believe, as an ICDAC, an agency provider, that you would like to apply for this, we do encourage you to complete the following application forms. The application includes completion of an online application, attestation to terms and conditions, and submission of the minority impact statement. Please refer to the following 2 informational letters, IL 2366 and an additional IL that was released just recently on 9/2, which is 2371. Now, the provider's responsibilities. You are required to maintain records of the receipt and distribution of the grant funds. As Iowa Medicaid, we will announce the timeline and methods of reporting at a future date. For federal reporting purposes, the Iowa Department of Health and Human Services will request information regarding how the funds are distributed and the impact of the funds on recruitment and retention efforts. Some potential uses of scholarship funding. Now, the following slides are intended to provide a big picture overview of the funding purposes. There, again, is more and additional information on our website. iStart certification, certification of positive behavioral supports, certified brain injury specialist, crisis response certification, behavioral health technician certification, employment support specialist, medication aid, community college or university courses in related fields. For example, crisis response provider training. The intent is to deliver crisis response provider training targeted at serving members with ID or intellectual disabilities or DD, developmental disabilities. Now, MFP, Money Follows the Person, is also supporting the expansion of iStart statewide. Is to develop resources and services for parents with IDD and parents and foster parents and guardians with children with IDD. Now, this funding will be used to develop resources, training materials, and ultimately specialized services for parents with IDD, foster parents, and guardians as well. Now, the intended outcome for health IT infrastructure is to develop a provider health IT infrastructure grant for the provider. For behavioral health, aging, and disability services system evaluation study, the intended outcome is to contract with a vendor to conduct a study and gap analysis of behavioral health, aging, and disability services, including the HCBS waiver programs. The intended outcome of the behavioral health, aging, and disability services system realignment implementation. The service system realignment should account for the interconnectivity between Medicaid state plan, HCBS waivers, and MHDS regional coverage of services and supporters. For TCM, or targeted case management, assistance with waiver applications. The intent is to provide an intake function, single point of entry, appropriate waiver application, obtaining the necessary documentation to support, and connecting to other Department of Human Services such as in-home health-related care, or IHHR. Now, could this link with the project to one-time screening of the members on the wait list today? And we know we have wait lists, and we are all on board with trying to understand how we can better approach the issue that we have currently in our state for the wait list. Now, the department currently contracts with Department of Human Services, TCM, to provide case management services to the HCBS waiver fee for service. Populations on the AIDS, HIV, health and disability, and physical disability waivers. The department could use the same reimbursement methodology to reimburse Department of Human Services, TCM, for assisting members with the application and referral processes. For the development grants, community-based neurobehavioral rehabilitation services, or CNRS pilot for children. Now, the intended outcome for this is building provider capacity through the development of one or more pilots to serve children with neurobehavioral needs in residential setting to avoid out-of-state placement and hospitalization. For the development grant, residential services pilot for children with complex behavioral needs, the intended outcome, building provider capacity through the development of one or more pilots to serve children with complex behavioral needs in a residential setting to avoid OOS placement and hospitalization, out-of-state placement. Now, the development grant for therapeutic foster home pilot. The intended outcome, building capacity through the development foster care trainings and support when caring for children with complex behavioral needs and trauma-informed care. Now, the ARPA also has an expanded remote support for HCBS provider technology grants. Now, the member monitoring system, installation costs, purchasing iPads or laptops for HCBS service sites programs, workforce support, investing in meaningful and sustainable solutions to attracting and retaining individuals to the important work of home and community-based services is critical. There's a one-time recruitment, retention, provider payment, and provider payments will serve the purpose of assisting qualified HCBS providers to fund recruitment and retention of direct support professionals. Additional resources that can be found here. And again, let's move on into prior authorizations. This is a short synopsis of the review procedures undertaken by Iowa Medicaid's prior authorization team. The department is monitoring prior authorizations daily, including the time period for approval, and will use this data to make changes if necessary. Now, the current turnaround time for a prior auth for Iowa Medicaid is 10 business days to review for normal prior authorization requests. If we do have to ask for additional information, it may take obviously a little bit longer. Now, if the authorization requires peer review or medical director or specialist review, Iowa Medicaid has up to 15 business days to complete an authorization. COVID-19 prior auth, the department is not waiving prior authorizations for Medicaid members during the COVID-19 pandemic. After COVID-19 pandemic ends, normal billing practices will resume, nor is the department extending all prior authorizations for continuity of care. Now, there is currently no change to the claims filing deadline of 365 days from the date of service for fee-for-service medical and dental claims. Please refer to your MCOs for their timeframes on the same issue. All right, we're going to go ahead and move into the Iowa Health and Wellness Plan, the IHOP. Members medically exempt, ME, status in IMPA. Please refer to IL 2367 for guidance on IL 2318, which is for skilled nursing facility services for IHOP and modified adjusted gross income, or MAGI members. Here's a quick overview of some of the acronyms that we are using on these screens. I did want to point these out. Many of you know exactly what these mean and some do not. So I did want to put some of this in here as well. Here are the tools for IHOP member eligibility for SNF and NF. Iowa Medicaid has implemented a medically exempt status lookup function within IMPA. The lookup function will allow SNF and NF providers the ability to look up an IHOP member's medically exempt status when the individual is admitted to your facility. The medically exempt application user guide will provide a step-by-step process for navigating that medically exempt status lookup function. Now, ongoing changes to IHOP members' medically exempt status will be displayed for you to monitor. The Medicaid member must be a resident of the provider's facility for that provider to access this information on IMPA. That is an important note. Now, SNF and NF staff are required to complete the enrollment form 470 5720 to access this information and the lookup function. The enrollment form and user guide are located on this clickable link for IMPA homepage. Again, if you do have questions, please reach out to us at IME Provider Services. The next slide, we're going to be talking about what Julie had mentioned, one of the issues that Julie had mentioned earlier, which is the ground emergency medical transportation, or GEMT. Many of you may not know what GEMT is and if it applies to you. So I did want to point out a couple of things with this program. It is a voluntary program that allows publicly owned or operated emergency ground ambulance transportation. Providers receive supplemental payments that cover the difference between a provider's actual costs per GEMT transport and the base payment, mileage, and sources of reimbursement. Now, providers receive payments for cost-based on a prospective basis for emergency ground ambulance transportation. The Medicaid fee-for-service and Medicaid managed care organization members under Title 19 of the Federal Social Security Act and the Affordable Care Act only. The provider must do the following. They must provide GEMT services to Iowa Medicaid enrollees and be enrolled as a provider for a period being claimed. Must be owned or operated by an eligible governmental entity to include the state, a city, county, fire protection district, community services district, healthcare district, federally recognized Indian tribe, or any unit of government as defined by the 42 CFR section 433.50. How can you enroll as a GEMT provider? Notify the Iowa Medicaid Medicaid Provider Cost Audit and Rate Unit, the PCA. You must complete an intergovernmental transfer agreement. Complete and submit GEMT program cost report. Complete the provider participation agreement. Complete and submit CMS approved GEMT cost report. Complete and sign the IGT agreement between Iowa Department of Human Services and the eligible governmental entity. And here are some resources for you as well. GEMT can be confusing for folks that have and providers that have not used this type of funding source previously. So I would encourage you, if you do have questions, to please reach out to the Dex Walker, the supplemental payment manager, at this information, phone number and email address. Now, most recently, Iowa Medicaid has put together a feedback survey for you on our provider manual. Again, this is our inclination to serve you, help you through the process, and be there for you when you have things that you see that we may not see, and feedback from you as our providers to help our members. So I want to refer you to the first informational letter regarding our provider manual feedback survey for providers, which is 2353. Iowa Medicaid is committed to improving the tools and resources available to you. Iowa Medicaid is currently refining the provider manual review process. And that's not to say it is not under continual review, which we do throughout the entire year. However, this is a new tool that we're introducing to help us help you with the provider manual. And with that in mind, we would like to incorporate you as our stakeholder with your input. We would like you to submit recommendations where you feel the wording is unclear or contradicts other language or content. Now, this form can be completed multiple times if you wish to submit multiple recommendations. We want to collect input on manual language, enhance communication and understanding between Iowa Medicaid and providers. And it is intended for recommending policy or coverage changes. Recommendations submitted through this form will be reviewed by our policy staff. We're going to go ahead and move into the program integrity, Iowa Medicaid program integrity. Why does program integrity exist? I have chosen a few select slides from our quarterly provider training that was held in March. This is considered to be an overview of this presentation, which can also be found on Iowa Medicaid's website under providers and training. Why does program integrity exist? Program integrity is designed to ensure that public funds are spent appropriately, that we are collaborating with law enforcement entities, and that the MCEs to detect, deter, and combat fraud, waste, abuse of Medicaid programs. Program integrity is designed to ensure that public funds are spent appropriately. So I have included a few words to bring this information to light for you. Now, we all probably know what fraud is, what waste is, etc. But I wanted to put it in the context of what we mean with our program integrity team. Fraud is defined as a wrongful or criminal deception intended to result in financial or personal gain. Fraud includes false representation of fact, making false statements, or by concealment of information. Waste is defined as a thoughtless or careless expenditure, mismanagement, or abuse of resources to the detriment of or potential detriment of the Medicaid program. And finally, abuse is defined as the excessive or improper use of a thing or to use something in a manner contrary to the natural or legal rules for its use. The function of state audits within our PI unit. to receive tips and investigate, conduct audits and investigation, and perform data analysis to identify potential risks of improper payments. Educate on proper billing practices. I do want to point out with the proper billing practices, I've spoken at length with our program integrity team, and the reason they are here is not just to be punitive, but to also help you through this whole process. Because as we stated earlier, it can be very confusing at times for billing with MCOs, with other types of federal and state guidelines and laws. So our program integrity unit would rather have you ask the questions than to have an issue later, which could cause no payment or a reduction of payment or a time lag delay in payments. So again, they would like to educate on proper billing practices, make recommendations for policy clarification, and receives self-reports of overpayments and issues, requests, and return of overpayments from providers. The Office of Management and Budget, which is the OMB, has identified Medicaid and the Children's Health Insurance Program, or CHIP program, at risk for significant improper payments. As a result, the Centers for Medicare and Medicaid Services, CMS, developed the Payment Error Rate Measurement, the PERM, program to comply with IPIA and related guidance issued by the OMB. Iowa Medicaid's role: to provide information to CMS, eligibility information, provider enrollment information, claims data, policies, and procedures, and act as a liaison between CMS and Iowa Medicaid providers. Your role: to respond to CMS's medical record request within 75 days of the initial request, within 15 days of an additional request, dispute resolution process, preliminary finding. You may submit a dispute resolution. Iowa Medicaid may request additional documentation. CMS findings are final. Their final findings are published. Overpayments identified by CMS. Iowa Medicaid pays a federal share. Providers are responsible for identified overpayments. Corrective action plans identify the root cause and steps to remedy the root cause. Again, our goal and our responsibility for program integrity is to receive tips and investigate, conduct audits and investigations, perform data analysis to identify potential risks of improper payments, educate on proper billing, make recommendations for policy clarification, and receive self-reports of overpayment of issues, request, and return overpayments for providers. Program integrity is here to help. They want to make all of you successful. Now, there is a referral program for program integrity, and these would qualify for that. Negative result on a background check, adverse action taken by a licensing authority, federally funded program, law enforcement prosecutions, and other state Medicaid programs. Prior sanction imposed by Iowa Medicaid, unresolved outstanding payments. What information are you required to disclose? Your name and address of any person or individual corporation with an ownership or control interest, or if an individual, the date of birth and social security number, other tax identification number, in the case of a corporation with a 5% or more interest. Here's some additional tips for timely processing of your enrollment application. Complete your enrollment application in its entirety. If required, insured required certification and licensure are in good standing. Prompt response to a request for additional information. So not only is this good for program integrity because they do review all our enrollments and how we conduct our enrollments, but our enrollment team is very dedicated to helping you through that process as well. What they need from you to begin with is a complete application, filling out all of the boxes necessary for your enrollment. And again, making sure that your certifications and licensures are not only attached, but also are in good standing. And if you should have questions regarding enrollment, again, our provider enrollment team is very good about responding to your questions in a timely manner and helping you through that process if you do struggle with some of the information on there. Oversight responsibility. The program integrity team oversees the MC provider tips and investigation, recoveries, and ensures compliance with federal regulations and provides training. Under the oversight performance, that falls under the program integrity unit. The reporting that they have is monthly, quarterly, and annually. They have monthly meetings and annual audits. To avoid sanctions, ensure contact information is correct and updated, comply with program requirements, maintain communications with Iowa Medicaid throughout the process, seek clarification if program policy is not clear, and remedy any outstanding overpayments. If a negative action was taken against you by a licensing authority, disclose that event. If you identify an error in payments, self-disclose. If you suspect fraud, waste, and abuse, report it. They ensure that all providers, fee-for-service and managed care network providers billing for Medicaid reimbursable services are enrolled and screened. They ensure Medicaid providers and fiscal agents disclose information on ownership and control. How to report. Here is a link for you on how to report any suspected fraud, waste, and abuse. General program integrity related questions or to verify if your provider is excluded from participation, contact imepi@dhs.state.ia.us. Now this screen here, again, some folks asked if they could print off some information. I have included all of their contact information on one page, just in case you wanted to take a screenshot of that if you should need that at your disposal, and it's easy to get to as well. However, all of this information is out on our website. Again, additional information for you. Let's jump into application and review forms. There's just a couple of slides on this one. If your office retains unused applications or review forms, please ensure that they are current and destroy all previous versions. This will help expedite anything that you are sending to Iowa Medicaid. If you have the wrong form, then we may have to send the information back to you and ask you to refill it out with the correct form, which takes time. And this could slow down payments and other issues that you may be having. So we want to make sure that you have the correct information. So you can find that information on our website and the correct forms on our website as well. The following has additional website information on it for the correct forms. please destroy all of the previous forms that were out there and use the corrected forms. And one more screen for you for future use. Payments cannot be processed if a provider does not provide required disclosures. All right. Iowa State's recovery law. Again, just a couple of short slides on this one. This applies to if the member is 55 years of age or older, regardless of where they are living. They are under age 55 and reside in a nursing facility, an intermediate care facility for persons with intellectual disability or mental health institute, and cannot be reasonably expected to be discharged and returned home. So this applies to those folks. After the death of a person who has received Title 19 funded medical assistance, the law requires that the individual's assets be used to provide repayment to the Iowa Department of Human Services. Title 19 funded medical assistance includes Medicaid and various waiver programs, including the Medically Needy program and the Elderly Waiver program. Federal law does require states to have an estate recovery program in Iowa, and the estate recovery program is provided under Iowa Code Section 249A.532. And then again, the administrative rules can be found here as well. If you do have questions about the Iowa estate recovery law, if you feel that it may apply to any of our members, please contact or have them contact the Iowa State Recovery's email address, phone number, or fax. And finally, we're going to jump into our welcome to our new MCO. After this brief overview of our new MCO, I will introduce you to Molina Healthcare representatives. This information for the announcement can be found on Informational Letter 2375. The Iowa Department of Health and Human Services has issued a notice of intent to award to 2 managed care organization bidders for the request for proposal Iowa HealthLink. The bidders announced Wednesday, August 31st, 2022 include AmeriGroup, Molina Healthcare of Iowa Incorporated. Molina Healthcare Iowa Incorporated will join AmeriGroup Incorporated and Iowa Total Care Incorporated as MCOs in the Iowa Medicaid program. Iowa Total Care Incorporated will continue to serve Medicaid, although they did not need to participate in this RFP due to the timing of their joining the Medicaid program. The following is a tentative timeline for implementation. These dates are estimates and subject to change. Contract execution, project kickoff, readiness review conducted, provider testing, and assignment of membership. Go live July 1, 2023. And watch your informational letters as we progress forward with our new MCO. Contracting providers wishing to contract with the 3 MCOs should directly contact those organizations. And I just want to briefly say, for those of you that didn't know, if you are new to Iowa Medicaid and you have never enrolled in a managed care organization, you must first enroll as an Iowa Medicaid provider. Once you are approved, then you can enroll with the MCOs. For this year, it would be enrolling with Iowa Total Care and AmeriGroup. And next year, we will be adding Molina Healthcare to that mix as well. But I do want to let you know that you must enroll with each MCO separately in order to provide services and to bill that MCO for those services. I have included contact information for each one of these, and I believe Molina Healthcare will also have their information on their slides as well. So for the next few screens here, I'm just going to let you know that these are resources available to you. The tools, trainings, and services link here also does include the quarterly provider trainings. I would like to ask you for suggestions for quarterly provider trainings as well as our annual provider training next year. I do take every comment, concern. I would like to get ideas on what you're seeking for training. Now, with the quarterly provider trainings, we do narrow the scope down from all provider types to the ones that it may apply to. So quarterly provider trainings may be specific to one type of group, and that's okay. Or it may be something as with the program integrity training that it's for everyone out there. So I do want those ideas. If you could send that to me at mjames@dhs.state.ia.us, which I can be found on this information below. Here's some additional resources for you. And again, just to follow up with Julie's information on the town hall, there's one for providers and one for members. Fourth Thursday of each month. And we're seeking to gather feedback on the current state of the program and how to improve. Director Matney has done a tremendous job of putting this together with our team. And she wants to emphasize that we truly are interested in your feedback and really would enjoy having you be a part of these town halls. And as I've sat through these and listened to the town halls, I gain additional information as well. There is a lot of good information available. And again, some additional resources for you. And to stay current on all matters related to HHS, vital and timely. These are the news and announcements that we have as well on policy changes, clarifications, initiative news, notices, current and upcoming events. As you can see, we're trying as many ways as possible through our informational letters to current matters related to HHS, to our town halls, to our trainings. We're really trying to connect with you as you are an intricate part of everything that we do. And finally, I would like to move on to introduce Molina Healthcare. And Molina, a representative from Molina, are you with us today?
Yes, Maria, this is Mike Weber. How are you this morning?
Hi. Yes, we met yesterday. Mike, did you want me to put up your PowerPoint presentation?
You know, that might be a good idea, Maria. My connection this morning is acting up, and I'm afraid if I share my screen that you won't be able to hear me. In case you do lose me though, Stacy Harris from my team is acting as my backup this morning, so she'll jump in.
I understand. Thank you so much for getting on today. All right, Stacy, can you see the slide?
Actually, you have up, yes, I do. I see it. I'm sorry, Mike, did you want me to speak or?
No, I can go ahead and take it
Okay.
in case I lose connection though.
Okay, got it.
All right, thanks. Maria, if you want to go to the first slide, or
Sure, there we go.
Well, good morning, everyone. I hope everyone's having a great week. And I just wanted to say on behalf of Molina, we are very excited to be in the Iowa market. My name is Mike Weber. I'm the AVP for Provider Network and Operations, and my team will be leading the network build for the Iowa market. And we're very excited to be here again. We're looking forward to working with Iowa Medicaid and AmeriGroup and Iowa Total Care and over the next few months, and just looking for that collaborative effort between all three to get to make sure that all the Iowa members are taken well care of. Just a little bit about Molina. Molina is our core business is Medicaid. We're currently in 18 states across the United States. In the Midwest, we're in Illinois, Michigan, Wisconsin, Ohio, and Kentucky. And so we have a strong history in the Midwest. We do understand Midwesterners, and again, just anxious to get started. The Iowa plan is being developed by Iowans for Iowans. So our plan president is Jennifer Vermeer, and many of you on the phone may know Jennifer. And Jennifer is now assembling a management team that of folks from the Iowa market that'll understand the contracting needs and needs of the members. So you should be hearing from her later this week, and hopefully in the next the upcoming sessions later in the month. Our implementation plan will consist of a 4-month build, which will start. The contracting effort actually is starting now. The 4-month build will consist of provider claims testing starting next in the first week in February. And the testing will be end to end. So if you do want to participate in the testing, our claims packets, or I'm sorry, our contract packets will have a checkbox.
Did we lose you? Yeah, it sounds like we did lose him.
Okay, I'll jump right in. This is Stacy. So as Mike was mentioning, relative to the contract campaign that's underway statewide, as he mentioned, you should be receiving the contract soon. And we are looking forward to participate in the state required provider claims testing starting February 1. So if you would like to participate, please pick up a contract packet at the on-site meetings after the meetings. Also, there's some contact information on the next slide as well. Also, lastly, I'll be quick. Provider education and availability portal training will be taking place in the spring, well in advance of go live for you providers, and will provide a wide spectrum of options, including virtual and in person. And they should be starting 30 to 45 days prior to go live. So if you have any immediate questions, please utilize the contact information. I believe that's on the next slide. And thank you very much for your time, and we look forward to working with you.
All right, I do appreciate that. Thank you, Stacy, for jumping right in there. I appreciate that as well. At this time, I do want to take about a 5-minute break so that we can get Iowa Total Care set up and just give you a little reprieve here for a moment.
Maria,
yes.
could I jump in for just a second? This is Julie. I just wanted to kind of clarify a couple of items that I saw in the chat, and I just thought it might be easier if I quick go over those. And then we'll let everybody go for a break, but I just wanted to clarify. So there were a lot of questions about the EVV and the implementation for January 1st of 2023. And so I just wanted to let everyone know that we have not released an informational letter yet on this. We're working through some questions about the requirements internally first. And we are also working on finalizing a good faith effort. There is an option with the CARES Act that we can submit a good faith effort exemption to request a delay in the implementation for up to a year. So that is our plan, to submit that good faith exemption as we work through some of the requirements and some of the questions that we have about that. So just wanted to let you know that before we do anything, you will get an informational letter. There'll be some training available. So more to come on that, but just to give you an update on where we're at on that. And then the other thing I wanted to spend just a little bit of time talking about is, I think there were some questions on when Maria was talking about the eligibility recovery claim submission guidance. And this is related to House File 736, which is in cases where the MCOs, or okay, let me start back. In cases where a member was eligible at the time that services were provided, so a provider checked eligibility and they verified that the member was eligible and they provided the services. And then later that member's eligibility was retroactively changed to ineligible. And so in those cases, the MCO is still going to collect the payment that they made to the provider, because the person that truly was not eligible for Medicaid services. But in those cases, then due to House File 736, what will happen then is, if you can, you verified that the person was eligible and you submit all that documentation, that will be coming out in an informational letter to you, so that you'll have all of the details of this. Then you'll be able to send that documentation into Medicaid, Iowa Medicaid Provider Services. And what we'll do is actually pay those claims that were verified that the person was eligible at the time that the service was rendered. We will pay those claims with state dollars. So I wanted to clarify that, and because I know there were a lot of questions about that I saw in the chat. You will get that informational letter. I think that it is either today or tomorrow you should be receiving that informational letter. So if you do have questions after that informational letter comes out, I encourage you to contact our Iowa Medicaid Provider Services unit so that we can continue to answer any additional questions that you might have. Also wanted to let you know, I think there were a couple of comments that all the questions and answers that we've provided in the chat or through verbal responses, or if there's some we're taking back to send additional responses, we will post all of those questions and answers on our website, along with the training materials that Maria and team have gone through today. So they'll all be published out there on the website. So everyone will have up-to-date information on whatever questions were asked in each of the sessions. So thank you very much. Thanks for allowing me to kind of take that minute to provide a little more clarification based on some of the comments that I saw in the chat.
I really appreciate you jumping right in there on that, Julie, because they would continue to come without having that response. So I do appreciate that. Thank you. And as Julie said, here's another reason really to get signed up for those ILs, because they are a great way for us to communicate to you on any of these changes that are going on. And Julie, one more thing, can I ask you to jump in on the logo that we have on our board here as well for just a moment before we hit break?
Sure. I think what Maria's referring to, and I think most of you have heard, that as of July 1st of 2022, the Iowa Department of Human Services and the Iowa Department of Public Health have aligned. And because of that alignment, we're doing some rebranding. And so some of our materials may start to look a little different with branding and color schemes and things of that nature. We're not going to, everything's not going to be changed all at once. Of course, we have some materials that have been printed and we want to use the materials that we currently have in stock, especially right now when there's paper shortages and there's envelope shortages and all of those kinds of things. But you'll start to see some of those changes in the logos with that alignment. And we just wanted to kind of make sure that you were aware of that.
Thank you.
Thanks,
I appreciate
Maria.
that. All right. Let's, it is 9:47 right now. Let's give it to about 9:55. so that we can get going on our Iowa Total Care and AmeriGroup presentations as well. Have a great break. See you at 9:55. Iowa Total Care, did you have your PowerPoint presentation or would you like me to click the slides for you?
We have it.
Great.
Can you see it on the screen, Maria?
I can see it on my screen. Yes.
Thank you.
Thank you for that. I appreciate it. Well, welcome back. I know that that was a very short break, but hopefully it gave you a chance to regroup, and I know it did for us here. So I appreciate your patience today and wanted to thank all of the attenders today for going through this process with us. And we want to make sure that you get all of the information. And as Julie stated, all of the questions and answers will be posted out onto our website as well. But if you do have specific questions for any of the MCOs or for Iowa Medicaid, please reach out to us for Iowa Medicaid. It would be IME Provider Services is a great place to start for answering some of those questions and getting that information back to you directly. So I did want to introduce Iowa Total Care, and who will be presenting today from Iowa Total Care.
I will be. This is Carmen Irwin.
Good morning, Carmen. How are
Good morning.
you?
I'm good. How are you?
Good. I can hear you just fine, and I see your screen. Well,
Great.
welcome, and please feel free to proceed forward. Thank you.
Thank you, Maria. Good morning. My name is Carmen Irwin, and I'm a provider relations specialist for the Territory Region 5 for Iowa Total Care. Thank you for being here with us today. If my mouse will work, I apologize. Iowa Total Care has local expertise, and we are a subsidiary of Centene Corporation with over 30 years of national experience in the managed care industry. Locally, we staff over 700 employees in and around the state. Our headquarters are located in West Des Moines to provide a central place for meetings and trainings. And we are now NCQA accredited. Our purpose is to transform the health of the community one person at a time. And our approach is to use focused, compassionate, and coordinated care from people who know you where you are from. We do this by focusing on the individual, whole health, and active local involvement. Our goal is to help each and every Iowa Total member achieve the highest possible levels of wellness and quality of life while demonstrating positive clinical results. And we do this by integrated care, coordination of care, along with continuity of care. Now we're going to go and talk a little bit about our member services and eligibility. Iowa Total Care provides health coverage for enrollees of the Iowa Health and Wellness Plan, Iowa Health Link, and the Health and Well Kids in Iowa, which is also known as Hawkeye. The core Medicaid benefits are covered, and all services are subject to benefit coverage, limitations, and exclusions as described in the provider manual. On the screen, there are links to both the member handbook along with the provider manual that would explain more information for you. Choosing a doctor is important for our members. Iowa Total Care has created a way for our members to have quick and easy access to finding a doctor in 3 ways. Either through our online tool, the provider directory, which is updated weekly, or by calling member services at 833-404-1061. For member resources, we are happy to have different programs that help members. We have the Start Smart for Your Baby, and that is gives us the customized support and care that they would need for a healthy pregnancy and baby. We have video appointments with a doctor, free smartphone from SafeLink, 24/7 nurse advice line, which is staffed with registered nurses and language access services, which has access to interpreters over the phone, face-to-face, or through remote interpretation. We also have a findhelp.org, which helps members find various assistance to different programs. Our non-emergent medical transportation is through access to care. Eligible Medicaid members or providers on the member's behalf may request a ride for a medically necessary appointment. And for non-urgent medical needs or routine appointments, members ages 16 or older may ride alone. To schedule a ride, call at least 2 business days in advance of the member appointment. Reservations can be made up to 30 business days, and for members who need dialysis, chemotherapy, or radiation treatment, that can be up to 90 days in advance. There are 3 ways to check member eligibility. A provider can check through the portal, IVR, and provider services. Please note that you would need the member name, medical ID, along with the date of birth. Members should present their Iowa Total Care card along with the Medicaid card. And if you do not know the person, they should show their ID. And here are examples of our Hawkeye ID card along with our Iowa Health Link ID card. And it does have information, contact numbers for both the members and the providers. Now we're going to talk about member grievances and appeals. With the written consent of the member, a provider or an authorized representative may request an appeal or file a grievance on behalf of the member. For appeals, use the authorized representative designation form. And for grievances, you would use the release of information form. And you can refer to the provider manual for more information on this. And both of those forms can be found on our website at iowatotalcare.com. And now we're going to talk about provider responsibilities. Some responsibilities for providers is initial credentialing and re-credentialing every 36 months, ADA compliance, to encourage members to execute advanced directives, to bill primary insurance prior to Iowa Total Care, and to communicate provider change of address, addition and termination of practitioner, and other important notifications. Other more responsibilities would be to maintain accurate and complete medical records, render medically necessary and appropriate levels of care, ensure PCP and specialty access 24 hours a day, 7 days a week, and member non-discrimination. For more information, again, you can find that on the provider manual. If you go to our website at iowatotalcare.com, you would hover over the providers, then it'll drop down to provider resources, and then you'll see like the manuals, forms, and so forth. For provider access and availability, network providers must comply with all access standards listed. And please note, for the hospital emergency availability and primary care physician availability, that auditing is done on a quarterly basis. For behavioral health and specialty provider availability, these audits are done on an annual basis. These are requirements established by the state and outlined in the provider manual. Fraud, waste, and abuse. Identification and reporting most common issues. Use of incorrect billing code, not following the service authorization, inaccurate procedure code for the provided service, excessive use of units not authorized, and lending of insurance card. Prevention is through enrollment and education of providers, staff, and suppliers. Detecting is by using data analytics and medical record review, and correcting is applying fair and firm enforcement policies and implementing corrective action plans. Critical incidents related to one of the following require Iowa Total Care by the end of the next calendar day. Physical injury to or by a member that requires a physician's treatment or admission to the hospital results in death, requires emergency mental health treatment for a member, requires intervention of law enforcement, requires a report of child or dependent adult abuse, a prescription medication error or patterns of medication errors that leads to outcomes 1, 2, or 3, and member location unknown. Now let's find out how to contract our contract and credentialing. If a provider wants to contract with Iowa Total Care, they can go to our website, again, iowatotalcare.com, hover over providers again, then select provider. Then you're going to see the contract request form, click on that. And please remember, provider network generally does not contract for transportation. To find the forms for enrollment and credentialing, again, you would go to our website, hover over for providers. This time you're going to want to choose contracting and credentialing. You'll then see all the forms that you want, and any of the forms would go in that area would be sent over to network management at iowatotalcare.com. For all credentialing and enrollment submissions, and once enrolled, keep enrollments up to date promptly by submitting the following: rosters. All delegated providers should submit quarterly full rosters, new provider adds, terminations, along with updates and changes. Now we're going to go to the electronic visit verification system. Case manager, provider services, and CareBridge can answer questions. For authorizations, service plans, and member eligibility, the case manager can assist. For questions regarding claim issues, payment issues, provider services would be the ones to call. And for any issues using the app or the IVR, you can call CareBridge. And all of that information is provided on the slide. And now we're going to move on to claims. We accept claim submissions, and they do have to be in electronic format. Claim submissions can be done through the portal, or providers can go through their clearinghouse. Our payer ID is 68069. If you need assistance when using a clearinghouse, you can contact EDI, and their information is provided on the slide. Ability is the preferred clearinghouse offering the following value services. They have transactions at no charge, claim submissions 24 hours a day, and web-based training and reporting along with customer service. We also accept transmissions through Change Healthcare and Ability. If you have any others that are not listed, you would want to, those would be reviewed on an individual basis. Here is what our timings are. So it's 100 days, 180 calendar days from the date of service for a clean claim. And what we consider to be a clean claim is a claim in a nationally accepted format in compliance with standard coding guidelines and does not have any defect, lack of any required document, and not requiring special treatment that prevents timely processing and payment. Claims that are clean but will not be processed under the clean claim timings include situations of suspected fraud and claims by third-party payers. Our payment policies, the goal is to achieve important quality of care and outcomes through policy guidance. Payment and clinical policies are reimbursed policies that notify providers of payment rules, and those can also be found on our website at iowatotalcare.com. And for PaySpan is if you want to get electronic payments instead of checks, it is a lot easier. It improves your cash flow because it's instant. You don't have to wait in the mail for a check. And to get set up, you can call PaySpan at the number provided. And here are the top 10 claim denials that Iowa Total Care sees. Duplicate claim service, CDR credit balance recovery, bill primary insurer first, and then resubmit with an EOB, ACE line level return to provider, the time frame for filing a claim reconsideration, no authorization on file that matches the service, the billing NPI is not registered with Iowa Medicaid, diagnosis code not correctly billed per ICD-10 manual, payment per state methodology, and auxiliary charges not separately payable. And here has some information on how to read our EOPs. You can use this guide to understand the information provided on a EOP in a simple to read format. You'll see at the top of the EOP, it provides definitions of the service detail columns. And at the bottom, the box provides explanations for the denial codes. And please contact your Iowa Total Care Provider Relations Specialist or Provider Services can also assist with any questions or concerns. Understanding the codes used on the claim details is key to knowing whether the claim was processed. So in this scenario, this is a clean paid claim. These are the easy ones. That's the service line is 0100, which indicates this is an original first time claim. On the second example, that is a clean denied claim. The service line 0100 indicates that this is an original first time claim. If there's an amount in the denied column, the denial codes will be listed. In this example below, denial codes are EF, ES, and EU. Explanation for these codes are provided on the EOP. This is where it gets a little not so easy. An example of an EOP to the reprocessing of claims, which results in a positive net payment, is shown below. So the original claim is indicated on their service line ending 00. The adjusted line is the service line ending in the odd number. In this case, it'll be 01. This is not a recoupment, but rather a financial adjustment to allow for the fully adjusted payment amount. The payment indicated by an even number, in this case 02, at the end of this service line is the final adjudicated payment of the claim. And then there's a scenario in the note area that kind of also goes a little bit further into depth for you. And this is for adjusted claims where there's a zero payment. In some cases, when claims were reprocessed, the original payment was the same as the reprocessed payment. To determine the net amount, you will receive in addition to the original payment, subtract the original claim payment, service line ending in the odd number 01, from the line adjudicated payment amount, which is in this example, service line ending in 02. In this example, the net payment result is 0. This means the original payment received was correct after the adjustment project was completed. Now the 0B adjustments. In some cases, a claim needs to be readjusted under a new claim number due to provider system configuration changes. When this happens, the negative adjustment will process with an explanation of code of JU to indicate an adjustment. And the positive adjustment will indicate explanation code of 0B. If you have a 0B adjustment and you do not know what the new number is, you can reach out to your provider relations specialist for a 0B crosswalk. We have two ways for claim disputes. The first one would be is to do a reconsideration on the claim if you do not agree with the finalized outcome. And you can do that through the portal or by submitting a provider dispute form, the form can be either found on our website or on the portal itself. Submission of request must be within 180 calendar days of the EOP. And if the decision is still upheld, then an appeal can be done. Request must be submitted on a provider dispute form and must be mailed to Farmington address that's shown. Submission of request must be within 30 calendar days of the reconsideration determination letter. And we will work to have the review completed within 30 calendar days. For provider complaints, providers have the right to file a complaint with Iowa Total Care. And the provider complaints can be filed regarding policies, procedures, and administrative processes in place of Iowa Total Care. The forms can be found again on our website under the provider resources. Provider complaints should be resolved within 30 calendar days, but there can be an extension from either side of an additional 14 days. And please mail the provider complaint to the West Des Moines location or by email or by fax. Our website has various tools to assist providers to get quick information. We have the prior authorization checker, the provider billing manuals are there. We have contract request forms. Our provider alerts are on the site along with other resources for you. We will keep providers aware of medical policy changes, payment and operational updates, and announcements using the following communication channels: the IVR system, guides and manuals, webinars, training sessions, provider portal, and provider service lines, amongst other communication channels listed. Once you've registered in the portal, some of the things that you can do is check member eligibility, submit claim reconsiderations, submit claims, download member rosters, manage and submit claims, along with submitting a prior authorization and viewing those prior authorizations, amongst other things. The Provider Services Department has trained representatives who are available to respond quickly and efficiently to all provider inquiries and requests. And here are the numbers to contact them at the 833-404-1061. And they are there 7:30 to 6 o'clock to handle your credentialing network status, claim status, and so on. And this is our map. If you do not know who your provider relations specialist is, you can see that there's regions, so it depends on what county you are in as to who your specialist is. And we also have, toward the end of the map, different specialties. And here is the long-term services and supports. They have managers assigned across the state who are available to assist with LTSS questions regarding case management, service authorizations, service plans, etc. And there is a link to view that map if it's needed. And HCBS is a person-centered planning approach that incorporates the full range of physical and behavioral health and support services that addresses functional, social, and other needs. Case managers engage with members of the chosen team, coordinate services to minimize silos. Members remain at the center of our award-winning integrated care model, and qualified provider partners ensure members receive authorized services, reside in appropriate settings, engage in their community, have the opportunity to either work and/or volunteer, and to receive reassessments if a significant change is observed. LTSS benefits include HCBS services and supports through the waiver and habilitation programs to help members remain as independent as possible in their home and community. They provide long-term care in an inpatient setting and provide service and support in the member's home. For all waiver and habilitation services, the service plan is the prior authorization request. The care case manager or IHH coordinator will meet with the service plan team to discuss what services are needed for the member to be successful in the next year. The care case manager or IHH coordinator will then submit the service plan for review. And does stand for Medical and Utilization Management. We're going to learn more about them. Here is the number that allows you to speak to a nurse 24/7. You can also make changes to your authorization, and if you have questions about that or anything else, you can give them a call. Care coordination is designed to help members obtain needed services using a multidisciplinary care management team. The provider's role in Iowa Total Care's care management program is extremely important. Practitioners who have identified a member who they think would benefit from disease or case management should contact their case management department to speak with a member of our integrated care team. And again, that number is the same, 833-404-1061. Integrated Health Home Care meets with the member's care team. Timely notification of discharge allows us to begin post-hospitalization outreach to assist members who needed follow-up care. Post-discharge outreach attempted within 24 hours of discharge notification. And our clinical practice guidelines, we have adopted those from American Academy of Pediatrics, American Diabetes Association, Centers for Disease Control and Prevention, National Heart, Lung, and Blood Institute, U.S. Preventative Services Task Force, and the American Psychiatric Association. If you'd like to find these clinical guidelines, they are on our website under the resources. Now for our prior authorization. We use these prior authorizations to ensure that all care is delivered to our members is medically necessary and appropriate based on the member's type and severity of condition. We work with our contracted providers to review certain testing and treatment decisions and verify that they are consistent with our clinical policies and philosophy of care. We consider to be medically necessary services means where a service item, procedure, or level of care that is necessary for the proper treatment or management of an illness, injury, or disability, such that the service will or is reasonably expected to prevent the onset of an illness, condition, injury, or disability, reasonably expected to reduce or improve the physical, mental, or developmental effects of an illness, condition, or disability, and to assist the recipient to achieve or maintain maximum functional capacity in performing daily activities, considering both the functional capacity of the recipient and those functional capacities are appropriate for recipients of the same age. And we do have our prior authorization check tool that is online on the main page. And if you go there, you can it will have a link if the service does need a prior authorization. There is a link to our portal for a submission request for that authorization. And you can submit an authorization 3 ways. You can either do it through the provider portal, through fax, or you can call medical management for assistance, and it's the same number, and then there's a extension for if it's regarding behavioral health. And here are our prior authorization timings. Please note, it's 5 days for scheduled admissions, elective outpatient services. Emergent inpatient admissions is within 24 hours or the next day of admission. Observation, no authorization or notification is required for in-network providers. Crisis intervention within 2 business days. Delivery is within 2 business days of the delivery, and for NICU would be within 24 hours. And failure to obtain a prior authorization may result in a claim to be denied. Medically necessary to treat an injury, illness, or condition that could seriously jeopardize the life or health of the member or member's ability to regain maximum function within 24 hours for the inpatient, and for outpatient, it would be for 72 hours, within 72 hours. If a provider receives a denial for a prior authorization, they have 2 business days after receiving the denial to request a peer-to-peer. Peer-to-peer is the only way for additional information to be given for re-review. To request a peer-to-peer, please call provider services, or for behavioral health, it would be option 2, then option 5. After the 2 business days have passed, and if the provider still feels that the authorization should not be denied and needs re-reviewed, the provider must go through our grievance and appeals process on the member's behalf. On July 1st, NCQA has added the requirement of all prior authorization requests for covered outpatient drugs to be completed within 24 hours, which we interpret by the end of the next calendar day we receive a request. It is possible to extend that time if we have not received enough information to make a determination, and we have specifically requested that information from the provider, and there is agreement that we may extend the time to make a decision, 72 hours for urgent and 14 calendar days for a standard. For pharmacy prior authorization request, these you go to through pharmacy, these that you go to the pharmacy to pick up and you take at home. This standard is already being followed. Please see the outpatient drug review timings. Our prior authorization for imaging goes through NIA. They are an affiliate of Magellan Health Services and is contracted to provide radiology imaging benefit management. Iowa Total Care oversees the NIA program and is responsible for claims adjudication. Services that are requiring are advanced radiology and cardiac imaging, CT, MRI, along with other things. Now let's move on to pharmacy. We adhere to the state of Iowa's preferred drug list to determine medications that are covered under the Iowa Total Care Pharmacy benefit, as well as which medications may require prior authorization. Some members may have co-payments or cost of share when utilizing their prescription benefits. And it would be located on the back of their ID card, or you can call provider services for that information. CVS is the pharmacy benefit manager providing comprehensive services for the maintenance of the pharmacy program. Iowa Total Care works with our internal Centene Pharmacy Services and CVS to administer pharmacy benefits, including the prior authorization process. Medications that require PA can be found on the Iowa Medicaid preferred drug list. For pharmacy prior authorization, you can do them through the pharmacy portal, by fax, or by calling the help desk at the numbers provided. The review timings are 24-hour turnaround for the decision. 72-hour supply of medication may be dispensed by the pharmacy to any patient that's awaiting a prior authorization determination in the event of an emergency, unless otherwise noted on the PDL drug list. And I would now like to turn over the presentation to the quality management team. Thank you.
Thank you, Carmen. My name is Nicole Fessler. I am within the quality team. I'm going to present on the next slides. If you can just move on to the next slide for me. All right, so Iowa Total Care's primary quality goal is to improve members' health status through a variety of meaningful quality improvement activities implemented across all care settings and aimed at improving the quality of care and services delivered. We focus on collaboration with providers to generate positive member health outcomes, improve population health, and ensuring our members are receiving the highest level of quality care. To assist in providing this quality health outcome, Iowa Total Care has developed an innovative clinical quality consultant program. That's actually my role at Iowa Total Care. We consist of a diverse team of registered nurses who serve as your individual point of contact. To the right, you'll see the how we are assigned per our territory. There's 6 of us in Iowa. We assist in the education and management of clinical requirements that are part of risk adjustment, HEDIS, state and CMS regulatory requirements, and other quality metrics. If you wanted to get contact information for your specific one, there was a link at the bottom of the page that you'd be able to utilize. This next slide shows our provider pay for performance programs. The first one we're going to go over is the quality pay for performance, or better known as P4P. This is to promote engagement with our members and improve quality metrics. Our objective for this is to enhance quality of care through a primary care PCP-driven contribution with a focus on preventative and screening services. Health Home P4P, the goal of this is to promote health home professionals, facilities engagement with our members and improve quality metrics. We want to enhance quality of care through a health home driven program by focusing on preventative and screening services. For the behavioral health incentive, the goal is to promote behavioral health professionals' engagement with our members to improve those quality metrics. We want to enhance quality of care through a focus on follow-up care, preventative care, and screening services. We have home and community-based services, HCBS. This is to increase health outcomes for the LTSS members and enhance quality social determinants of health through increased participation of LTSS providers. Other program incentives that we have would be the Continuity of Care, or COC program. The goal of this is to identify those high-risk members for care management and additional resources, close care gaps, avoid potential drug disease interactions, promote routine, preventative, and chronic care services, recognize and reward those providers who collaborate to deliver quality care and improve their documentation. Objective is to encourage providers to accurately assess members' pre-existing or suspected chronic conditions thoroughly. Then you have the Iowa Total Care Coding Accuracy Program, better known as ICAP. This is to identify high-risk members, close those quality care gaps, avoid potential interactions, and coordinate care collaboratively. We want to ensure those medical record documentations reflect accurately in the medical claims submission. Then we have our notification of pregnancy. This is to identify those pregnancies as early as possible, decrease barriers to prenatal, postpartum services, and improve maternal and neonatal birth outcomes. We want to enhance communication with our pregnant members through provider interaction. Then we have HEDIS 101, which is the Healthcare Effectiveness Data and Information Set. This is a set of standardized performance measures developed by the NCQA. I would hold a care accountable for the timeliness and quality of healthcare services delivered to our diverse membership. HEDIS rates can be calculated in two ways. You have your administrative data, which consists of claims or encounter data submitted to the health plan, or you have your hybrid data. This consists of other administrative data and a sample of medical record data. Hybrid data requires review of random samples of members' medical records to abstract data for services rendered, but were not reported to the health plan through claims and encounter data. There are ways to improve your HEDIS scores. You could understand the specifications established for each HEDIS measure, which we do have a HEDIS quick reference guide on the website for additional information. You could submit claim encounter data for each and every service rendered. Ensure to chart documentation reflects all services that are provided, and build those CPT 2 codes related to HEDIS measures such as BMI calculations, eye exam results, and blood pressure readings. CAHPS, the Consumer Assessment of Healthcare Providers and Systems. CAHPS is a standardized patient survey developed by the Agency for Healthcare Research and Quality to determine patient satisfaction with their providers, health plans, and healthcare. The survey asks patients about their physicians. They ask, is your physician explaining things in a way that is easy for the patient to understand? Is your physician listening carefully to the patient, showing respect for what the patient had to say, spending enough time with the patient, advising the patient on health improvement strategies, seeming informed and up to date about the care the patient got from their specialist. How to improve those CAHPS scores. Providers can directly influence their CAHPS scores with every interaction they have with their patients by using the alert model. That is A for always, L for listen to those patients carefully, E for explain in an understandable way, R for respect what the patient says, and T for time management perceptions. Behavioral health echo survey. This experience of care and health outcomes survey is standardized patient survey developed by the Agency for Healthcare Research and Quality to assess and improve the patient's experience with behavioral health, mental health, and/or substance abuse services. What the survey asks patients about their experience is, are they getting treatment quickly? How well clinicians communicate? Informed about treatment options, access the treatment information from health plan, office wait times, informed about medication side effects, received information about all managing conditions, informed about patient rights, ability to refuse medication and treatment, rating of counseling or treatment. And then also you have the same that you can influence those scores with that alert model as well. Member outreach. Effective frequency of contacts. This is to increase awareness, education of preventative and chronic care wellness to positively influence members' intent to active care. Channel maximization, utilization of multiple channels to influence member behavior while building a plan to engage members holistically. They have auto dialer calls, also as POM, texting, electronic website portal, community engagement, live calls, and mailings. If you want more information, there's a link to the website there. Member incentive programs, we have My Health Pays Rewards. This is a reward program for members to encourage preventative care. Members can earn by completing healthy activities like a yearly wellness exam, annual screenings, tests, and other ways to protect their health. Provider can submit a claim with the correct code and it will prompt a reward. They can spend these rewards at Walmart, Sam's Club for everyday items, household utilities, phone bills, public transportation, or rideshare. If you have additional questions, you can definitely click on those links there and they will take you to the website to answer those, or there's a link to that form that you see a screenshot of on the right side of the screen. All right, I'll pass it back over to Carmen.
Hi, Carmen. Thanks.
Hello.
Turn that back over to you.
Trying to get my computer working.
No worries. I think we've all learned how to be patient with the online technology.
Right. For our provider engagement, IO Total Care's primary quality, I'm in the wrong slide, sorry. And for our resources, we have three territory maps. So as you can see, there is a provider relations territory map, the provider relations specialist map, along with the clinical quality consultant map, which is all on our website in the provider resources. Iowa Medicaid information is there's a provider services for Iowa Medicaid, and our website is on the bottom, and we have the mailing address along with the fraud, waste, and abuse and compliance email. Here is our contacts for various departments. As you can see, the number is 833-404-1061. To make it easy for providers, you would just need to know the various options. So I would maybe print this list off and keep it handy because just for easy access. Member services would be your 1, healthcare provider would be option 2, and so forth. And here is for vendor support, the 24/7 nurse advice line that was talked about is on here along with where to find that information. Interpreter services would go to the same number. And then there is a request form on the website. And access to care, you can get a hold of them by calling us option 1, then option 2. And our specialty providers for Iowa include Involved Vision, Centene Pharmacy, NIA, and these companies handle their own claims and customer service. And the Involved Vision is up there if you need to contact them, along with PaySpan. And Centene Pharmacy Services look to Benefit Grid in our provider manual for coverage limits. For pharmacy network enrollment and remittance issues, you can call cvs@caremark.com. And thank you so much for attending. Have a great day.
Thank you, Carmen, and thank you, everybody from Iowa Total Care. I really appreciate the presentation. Did a wonderful job on that, and lots of good information. I do see that we have folks that are putting in comments and questions. Please do feel free to use that chat. These will all be recorded and responded to at the end of our presentation series. And I would like to bring on AmeriGroup right now. Do we have someone there from AmeriGroup that would like to share their screen?
Good morning, Maria. This is Lisa Barton. Robin was listed as the presenter, but it will be myself, Lisa Barton, doing the presentation today.
Great, thank you.
And we are getting queued up.
I do see your presentation on my screen.
And let's see if I also need to share my screen. All right. I am just looking to get to share me presenting. So I'll take a moment here.
I can actually see you.
Oh, can you? Oh, well, great, wonderful. I'm not as familiar with Zoom, so thank you. I appreciate that feedback. All right, good morning, everyone. I'll work to bring some energy. It's kind of tough after several hours of absorbing all this information to stay engaged. So I'll put some energy with this. First of all, again, my name is Lisa Barton, and I am a provider experience manager with AmeriGroup. I've been here with the organization for a little over a year. I am one of 14 team members who support providers across the state and also with our contiguous states. Now, if you are a provider between the counties bordering, uh, if you are a provider from the Sioux City down to the Council Bluffs area, I am the provider experience manager that supports this region and also in the state of South Dakota. So with that, I'd like to go ahead and get started. The presentation, what we'd like to cover today during this presentation is really outlined here for your reference. Certainly the number one thing that people are always looking for is, where do I find? Who is my provider representative? Where can I reach out to provider services, etc. So we will review that information. I'll provide an overview for your reference. Secondly, and this will be really key, Availity. Availity is a tool, a separate vendor that we work with for many of the services that are provided through AmeriGroup. So we'll touch on that. And from last year, we will build upon our common FQA and resources that are available to our providers. And I'd like to talk more also about our digital provider enrollment. This is an enhancement that we are able to offer and look to continue to expand upon. And then a few final notes about utilization management updates, LTSS updates, as well as just a few final comments for your reference. So with that, let's go ahead and transition and talk about how to contact us. How to contact us. If you are searching for your representative or other individuals to work with us, please go to our website. You'll see that listed at the very first bullet. In that is a great tool. There are so many things you can find on our website. And you'll see that if you navigate to the bottom, you can find a tab and it says Contact Us. This is how you will reach the provider services representative and other departments, such as provider services, as the general call center, or if you need to do prior authorizations. And you'll see that's applicable for both Medicaid and Medicare lines of business, as we are expanding into Medicare as well. Now, in the past, individuals may be familiar with being able to see the map. But you now have that ability to look up your individual representative by that function. Now, also on our website, you have the ability to receive bulletins. There's a lot of good information that we provide, and I'll be honest, we as representatives go out there to not only find answers to provider inquiries, but also to obtain the documentation that we share with you. So if you're interested in anything, please consider going to that website. Again, you can sign up for communications, notices of policy changes. You can get our monthly newsletter. Just a lot of information is available there. And you'll see that if you go to our communications tab, you can sign up for a lot of that information. I also want to note that we archive our information up to 3 years. So if you have something that you remember from last year or the year before, that should still be out there for your reference as well. So moving forward, sorry, just had to get a drink of water. Availity. You will hear me reference Availity as a resource throughout this presentation. As I said, it is a key tool that is used in support of our providers, offering many different functions and features. As you'll see with our first bullet, that availability is a source. If you're checking benefits, you want to check eligibility, you want to look at our claim information, what's the status of your prior authorization. So much information is offered through our Availability portal. As you'll see, it's free. You just need to register, and there are self-guided learning tools, whether you need a reference tool, you want a live presentation. Those functions, those opportunities are all offered through this vendor. And it references, you'll see, change administrators or how to get real-time help. As I mentioned, this is a separate vendor, so we want to route you directly to the subject matter experts if you have any questions or you're having any issues in trying to access or use this tool. We want to encourage you to reach out directly to Availity representatives. Now, this reference to the administrator, every organization who chooses to sign up and work with Availity identifies someone who will serve as their representative, their administrator. The role of that administrator is to ensure the appropriate people have access, and if someone is gone, that access is terminated, certainly. And that individual also outlines and defines the access for each individual within their organization and what they can review. You will see that if you are trying to identify, you don't have the same access, you can't see the same things as your colleague, your coworker, we encourage you to go and check and identify who the administrator is for your organization and work with them to refine anything. So moving forward from that, new in Availity. In Availity, we now have the interactive care reviewer and key for requesting prior authorizations. Anything we can do to streamline processes, we truly want to do so. And as you'll note, it should be the primary method of requesting behavioral health authorizations. So we are looking for our behavioral health providers to really capitalize on this feature. What we value about this partnership with Availity and being able to offer providers this tool is that you can get on 24/7. If there's no limitations, if it's evening or gosh, I can't get in, I can't reach anyone, I can't do my work because it's the weekend, etc. And our hope is that it facilitates and provides a little quicker access to care. Also, as we all know, with electronic medical records and initiatives, that we want to minimize any potential errors or mistakes that occur because of illegible information, whether that's handwriting or different tools or attachments that, such as the fax received that we can't read or it's shaded too dark, etc. A nice feature too is we are expanding the ability to provide attachments to different items within the Availity tool. I would again encourage you to go to their website and you can learn more about including that, whether it be for claims, reconsiderations, etc. And also moving forward, authorizations, you can always check what is the status of my authorization. Maybe it can be automatically authorized. Just a lot of good tools, and I'll touch on more moving forward. But at this point, let's just transition on. This is really going to be the bulk of the presentation. And for individuals who have worked with AmeriGroup or you have, if you've worked with AmeriGroup in the past, you'll remember this potentially from last year, or if you are new in supporting and working with AmeriGroup claims, this will be a key piece for you to be aware of and the topics contained within. The number one question, what do I do? My claim is underpaid, it didn't process correctly, or it didn't pay at all. Where do I go? How do I address this? The number one question. As you'll see, the first thing that comes up, you can dispute your claims in Availity. There is a tool where you can go to your claims and payments. You'll see the steps that are outlined within our slide. And we have found that over 70% of our providers use this feature as the means to request a reconsideration for any claims issues that may present. Now, maybe your office has a limited amount of exposure to Medicaid patients. And so you're not as familiar, you don't work with it as much, or you just prefer to speak to someone. You will also see that the second option that's available to you is by calling our provider services line. In that, you can request, again, a reconsideration for a claim that you feel is underpaid, paid incorrectly, or if you question why it wasn't paid at all. And you'll see some details as well at the bottom of our slide to facilitate that process. And some additional details I would like to share on the next screen is specific to your tips that we can offer you to facilitate this process. We are looking, if you are not working directly with a live person and you are documenting, it is key for us to understand your questions or your comments by specific and detailed, accurate information. So what does that mean? Well, in some cases, we have where a claim is submitted and there's no information, or it's stated, pay this claim, it paid incorrectly, and the reviewer is not going to understand exactly what you want them to focus on. What may be apparent to you may not stand out to them because they're reviewing a wide scope of claims. So if to allow us to give you that specific detailed response, we ask that you let us know exactly what you see is wrong. As of this date, we show this provider was credentialed and the claims for these dates of service denied as out of network. Then the reviewer knows exactly what they need to look at to address your specific question. Now, a key point that you'll see we have noted here is that when it comes to claims disputes, we follow OCE and NCCI edits. So even if you have medical records and you wish to dispute, those are the baseline tools and resources that we go to address how claims are to be processed. So I think that's important to be mindful of that, and make a note of that so that it is, you can use your time wisely, and that is a tool where you can go for additional information. Now, these dispute tips that we're sharing with you and these functions, it's important, these are only for the underpaid or claims you feel were not processed to your expectations. We'll get into more details about what to do with overpaid claims. A few additional points we'd like to highlight. If you're billing a service that is not on the IME fee schedule, it will not be paid. So we are only authorized to pay for claims for services and codes that are included on the fee schedules, or information which I'm sure all of you are familiar with can be found out on the IME website. Finally, we want to make sure that if you do have any attachments or supporting documentation, that it's legible. There's nothing more frustrating. You put all that wonderful documentation together, send it to us, but if we open it and it is shaded too dark to be able to read, we again will be challenged in being able to support you with your questions or concerns. So from there, I'd like to transition to the topic of claims and being overpaid. And this really fits into two different categories. So for the first one, let's just talk about if you find that you have a claim, Amerigroup has overpaid, what do? You have different options available. Certainly one, go to our website and you can search for our refund form or our recoupment form. What is the value of this form? Well, if you choose to send a check back to Amerigroup for the overpayment, we want to ensure that we know exactly who it goes to. Some of you may have multiple tax identification numbers, and we want to be able to ensure that we map your refund to the appropriate entity and claim. We certainly don't want to have a claim floating around without this key information and leave that hanging out there as unfinished business with you. Additional information that we have on that on the next slide is specific to our cost containment unit. Now, certainly when there are overpayments, these functions are handled by our cost containment unit. And as you can see, that is a separate department that we collaborate with and that they support different teams nationwide. So if there are any questions or if you need assistance, we also turn to our cost containment unit as well, and you'll see that number is listed there. Now let's go on to more information as we get into things such as recoupments or an overpayment notice. Now, if you receive a letter from a
Lisa, it looks like you've frozen in time. We're not able to hear you at this time.
wish to email information, that will be key. And I want to let you guys know my internet cable may not be, or it says my internet is unstable should I disappear. So, but anyway, going back to overpayment notices, again, that letter is key. That is your, that is key in being able to get a resolution moving. As you'll see, timely filing, if you want to dispute a project, you have 120 days from the first notice. And if you want to dispute, or if you are timely filing to submit a primary EOB, it's 180 days. If you have other health insurance, no dispute is necessary. So that's a key piece. I think that there are, that's a key topic to have. Now, it is not required to send notices to CCU informing us that you've submitted information. So, you know, if we can save you a step, I know there are plenty things that we need to partner with you to complete, but if we can eliminate a step, we definitely want to do that. And then finally, to reiterate, the payment coupon from the letter, that is what was referenced as a recoup form. That allows us to take remit the information that you might return to us and map that to the correct and appropriate entity, tax identification, and claims. So if we move on from there, the next piece that we find, a frequently asked question that we hear about and want to make a point to clarify for you, is if you find that you have claims that are denying and they are for NDC codes. So a completely new topic that we're talking about now. There are these claims, as you'll see, those are the claims that you might receive a denial code of F89 or F90. It means that the drug is not showing in our records as part of the Medicaid drug rebate program. So we are unable to reimburse you for that service. And our source of information is the information letter that you see listed there, 1897. And I'm sure most of you or all of you are familiar that you can go to the website for IME and you can search for the different informational letters as resources, which also serve as our guidance on how we are to be covering services for our insureds. So segueing back to the drugs, key pieces, what we find most frequently is happening if there's a discrepancy, then there is a potential with a CPT code it was used. As you'll see, the dosing, the strength, was it a vial? there are different pieces, the different elements that go into a drug. Maybe the drug is listed, but not in the delivery system that you provided. Again, that is all key information, and you'll see that we have provided a link so that you can readily identify that information. Now, should you find that you feel that you have claims that were processed in error, certainly go back. Let's request a reconsideration through Availity or contact our provider services. So moving on then from there. The next most frequent topic or discussion item that we hear about from providers, or they would like more information on, has to do with our electronic funds transfers. Now, the vendor that we use through AmeriGroup to manage this process for us is EnrollSafe, and we transitioned to this vendor late last year. If you want to enroll with this vendor for EFTs, or you have questions, you need assistance, please note the contact information that we have included for your review, and keep that handy to get yourself set up. Now, in addition to EFTs, there's electronic remittance advices, and we would love to do everything electronically as much as possible. I know some of you have some extensive remits that you receive. So as you'll see, once you're enrolled with an EFT, you should be able to access your electronic remittance advice. And to access that, you'll see that you will receive a trace number that matches to your file. Again, here's that the functionality of Availity. We're using that tool, and as you see, you can log in there to get that information. Now, if you opt to use a different clearinghouse or billing service, please see please use the clearinghouse or billing service, and they will supply an 835 ERA file for you. Kind of sorry about that, having to struggle to get through that one. So in addition to ERAs, as we move on, now I know that this is a key topic, timely filing. Let's kind of review what timely filing looks like. So when we are looking at timely filing limits, providers that are participating with AmeriGroup, whether they be individual providers, facilities, ancillary, you have 180 days from the date of service to submit the claim for processing. And as you'll see, you have 365 days to submit corrected claims. That clock begins at the time of the last EOP that you receive from AmeriGroup. Now, going back, we talk about those first level claims disputes. If you want to request a reconsideration for payment, then please do so within 120 days from the date of your explanation of benefits. That process, again, you can go through Availity or call into provider services, and they can assist you with that. You also, if the results of the reconsideration do not meet your expectations, then you have another 30 days from that decision date to again reach out and appeal and request another review. And maybe you have additional information, supporting documentation as to why this should be covered. So as we transition on from this, I want to also highlight for you the timely filing limits for prior authorization appeals. So as you'll see, 60 days from that denial. So if you receive that denial, you also have that ability to reach out within 2 business days to request a peer-to-peer review. And then the provider requesting services can reach out and work with our medical director for further discussions on why those services are needed. And as you'll see, The phone number is provided for your reference to reach out for that service. And so moving forward from so the question is, how do I find out what's happening, if there's any issues that are occurring, what are new initiatives, any topics that we relate to? Again, I take you back to our website. From our website, go to the Communications tab, as you'll see highlighted on the screen. You can go to our provider newsletter, and there will be the newsletters that go out. They're extended on a monthly basis, come out the first of the month. And as I mentioned previously, they are kept on the website for up to 3 years and archived there. You'll see where you can just pop down there and look at the most recent one, or if you want to catch up on past additions, you can go if you have a historical document that you'd like to go to. So I'd like to take us on to our next item. So from here, I would like to transition to a completely new topic. Moving away from our frequently asked questions, I'd like to talk about additional features, digital provider enrollment, again, that is offered now through the Availity website. So what is digital provider enrollment? It really comes to us we offer it in two different manners, two different ways. One, if you are a new provider and you're joining an existing group, you can add a provider through this tool. So you can say, gosh, I've got Dr. Smith. He's joining us at the end of his residency. I need to get him added. In the past, you have been able to send it in through our Iowa Medicaid mailbox. And we now offer another option, and that is if you wish to send the information to add new providers to a participating group, you can do that through our digital provider enrollment feature. Now you'll see there's a second piece to this, and that is also if you are a new group or you are a new organization wanting to participate with AmeriGroup, you can also go to Availity and begin the contracting process through this tool. It's great. It allows you to track information, get everything started contractually, and then also pursue forward with the credentialing process. But with this, we do have a caveat, and I want to make sure to really highlight our note at the bottom. And that is today, this feature is only for our providers who are not ancillary or facility based. At this time, we haven't reached the point that this has been extended or expanded to support these provider types. In these instances, we do ask that you continue with our current process. You can reach out to provider services or reach out to your provider representative, and we can get you connected with our contracting team to begin the process. So again, other services that are available are other tools that we have through provider enrollment. As we move on, how can you do this process? How can you complete this process for a digital provider enrollment? Again, just log into Availity. As you'll see, that theme continues to come up repeatedly. And so you'll see how valuable this tool can be in working with AmeriGroup and streamlining and allowing additional tracking tools. Again, you just create your own personal user account for you under your organization. And then you'll see that you can add users and then add the function to allow you to do provider enrollment. And you'll see that we've highlighted the tools and what you choose to do for your convenience to the right of the screen. This is where you can load the CAQH profile for the provider and ensure and attest their profile is current and accurate, or load that information for the provider. And we do want to clarify, we want to make sure we can access that. Sometimes our credentialing team does reach out to our the provider experience reps to request that this be allowed. Sometimes we don't have access to that. So if you can double check that, as well as your primary specialty that that provider should be listed under, that will assist us in moving forward. And when you select your provider enrollment, you will see that that's where you can select a AmeriGroup, go to applications, and really get that process going. Again, this is all available to you through our new digital provider enrollment. So from there, let's transition to utilization management. As I mentioned, we had just a few updates on to share with you. So for utilization management, let's talk about our prior authorizations. To revisit, all inpatient services require prior authorization. I don't think that should probably be a surprise, but just to reiterate to everyone that expectation and also clarify that hospital observations do not require the PA, as noted. We ask for notification at that time. Also for your reference, the behavioral health services always require pre-certification contingent upon specific revenue codes. But again, you can turn to the interactive care reviewer, which we discussed or touched on earlier, as a tool to get those authorizations submitted electronically. In addition, there is a great tool, and if you are not familiar with this, I think you will find this very helpful. I know that I use this as a provider experience manager, and that is our Pluto tool. What this tool is, if you want to confirm or check if the CPT code or HCPCS code that you are looking to bill requires pre-auth, plug this in, go out to our website. You can pull up this tool, populate the information as you see listed there, and it will tell you if pre-certification is required or not, and also provide you with any clinical guidelines as well to assist you. As you'll note, again, as we expand into the Medicare arena, this is applicable for both our Medicaid and Medicare lines of business. But this is a very valuable tool, and I find that I use this in answer to other provider questions. Moving forward from this, we have just a few LTSS updates as well. And it's, as you'll see, specific to the community integration efforts, an initiative that really got started several months ago. And it's where we are working to support members transitioning out of our resource centers. And as you'll see, this program provides incentives for these providers to work with AmeriGroup to facilitate a person's transition to the home or community of their choice. And we also have a skills system training that can be made available to assist providers in working with these members as well. And as we move towards the end of the presentation, I just want to touch on a few final pieces. And that is just a couple final comments specific to COVID-19 updates, vaccine distributions. So as you know, throughout the pandemic, we have made information about the COVID vaccine available to our members. And if you are interested in working with us as they continue to roll out additional booster updates and additional services, we ask that you reach out to your provider services representative. We can provide you with the shots, the vaccines, we can provide you with clarification. And we also have others like the influenza, the flu shot too. All of this, as you'll see, is all at the guidance and the direction of IME and DHS and specific to our current public health emergency and vaccine distribution protocols. A few final comments beyond this. In close, we also ask if you receive a provider satisfaction survey that you complete this process. And we do ask that you provide honest feedback and return that in a timely manner so that can be compiled and shared with our organization to see how we can continue to refine and support the individuals who are providing these services. I know everyone has been busy providing or doing questions in the chat. If you have anything else that presents, please feel free to add those additional comments there. We do thank you on behalf of Iowa of AmeriGroup for this time. Thank you.
Thank you, Lisa. I really appreciate your time, and that was a great presentation. As you stated, we have generated numerous questions to be answered, and through the chat, we will be continuing to answer those questions. But I would like to start the question and answer session here by giving just maybe a brief overview of any of the common questions that have been asked of either Iowa Medicaid or AmeriGroup or Molina. I do want to start with any observations or any questions that are repeated out there that AmeriGroup has had that you would like to address verbally. Again, all of these will be answered in our question and answer session. So I am going to keep this open for the next 30 minutes because we do want to make sure that if you would like to stay on and watch the chat boxes for additional information or responses. But AmeriGroup overall, as you're monitoring some of these questions, are there ones that kind of stand out to you as common questions that can be answered, or anything that you would like to answer verbally while we do have the entire group here? Gonna kind of put you on the spot there from AmeriGroup. AmeriGroup, do you have anything that you would like to add to that?
Hey, Maria, this is Julie. And I was doing the slideshow, so I'm just kind of scrolling through the chat messages. I mean, I think we addressed the responsiveness. Please reach out to myself or Megan Lamore. Our email addresses are in there. I know sometimes we don't get back to people as quickly as they would like, as we would like, so I can address that. And then really the individual provider situations, it's easier if you just either reach out to your individual rep. You can always copy me and look at those individual situations. Those are just harder to do in a group environment.
Agreed. And that would also go with Iowa Medicaid as well as Iowa Total Care and Molina Healthcare. I did not see, and I haven't had a chance to review all of the questions, but did Molina Healthcare, did you see any items in the chat that were related to your group, or would you like to add anything to the presentation today from Molina? I believe Stacy, are you still on?
Hi, Maria. This is Mike. I'm back on. We'll go back to the chat to see if there's anything that pertains to Melina and respond to those questions. Apologies for my connection from before. So we'll go back through and make sure that there's no unanswered questions. We'll also provide a link if folks do want to contract with us. We'll provide a link to our MHI contracting mailbox. So if you want to just forward your name and contact information to us through that link, we'll get back to you with a contract packet.
I appreciate that. Thank you so much. I will, again, just keep this chat box open for the next 30 minutes as our teams collaboratively are looking at some of these. If you've asked a question, then they will be reviewing these chat messages. But I did want to give Iowa Total Care a chance if you had any additional input to some of the chat responses or questions that you've seen on there.
Maria, this is Linda. So I think we've pretty much answered all the questions that are out there. I think the one question that applies to both of us is, yes, the slides will be available for them to print off at a later date.
Great. And Tuera from Iowa Medicaid, did you have anything that you would like to add as to anything that you saw in the chat boxes or presentations today? All right.
Okay, there I am. Sorry, Maria.
That's okay.
I was muted. I'm still looking through there, but as of right now, I don't see anything yet. So I'm kind of trying to, weed through to see what fee-for-service stuff we might be able to address if it was left unanswered.
Okay, and again, we are going to have our teams continue to take a look at these questions. And then if you did have individual questions that pertain directly to you and your group, I would suggest, again, as well as what's been said before regarding this. And I see that there's like an additional 7 questions here. So I am going to just grab the last one from Randy. It looks like, will IME be adding a claims option to their website? As of now, we can only check for eligibility. So anybody from Iowa Medicaid, would you be able to answer that? Will IME be adding a claims option to their website?
And this is Tuera again. I don't know if Randy's able to clarify. Are we asking if we're adding an option to like submit claims on our website, or are we referencing like checking statuses of claims?
Randy, if you wanted to unmute yourself and answer that would be great.
Yeah, so I was more asking about checking claim status, or if we have a claim denial, being able to view that on your website and appeal from there. As of right now, when we just log in, it's only being able to check eligibility.
Okay. I might have you email in, because are you logging into the ELVS website? Is that correct?
Yeah, it shows up with like the Department of Human Services logo, and then it just gives an option of home eligibility or provider summary. It does have a button for claim status, however, it's grayed out and we're not able to use it.
Okay. If you want to go ahead, and I will put our email address in there, we might have to get you access, and that's through EDISS, our vendor.
Okay.
But you should be able to check claim status on there. So I'll go ahead and add that website in there, and then we can get you the information to contact EDISS to see if you just need to fill out some access forms to check that, okay?
Okay, that would be great. Thank you so much.
Thank you. I appreciate
You're welcome.
Yeah, so looks like Tuera will be adding her email on there for you, Randy, on that one. Again, just grabbing the low-hanging fruit, if you will. It looks like RANGENM put a question in there for the last question on the chat box. IME, can you answer the Slim B question? Are we allowed to bill the patients for the co-insurance and co-pay? Anybody from IME able to answer that? To where are you still on there? I'm not hearing you if you are. Or if we have Desiree on board as well.
Hi, Marie, it's Desiree. As far as I know, we might want to confirm, but members can be billed if they're on Slim B. But we can take that back and get an official answer.
Okay, I appreciate that. Thank you.
Yep.
All right, and then it looks like another question came through from Amanda Babcock. Our day have claims, the T 2021 and T 2020 submitted directly to IME are still being paid at last year's rate. You're asking about rates. So is there something I need to do to get those corrected? Is there anybody from our team from IME that's able to answer the question related to day have claims that are being paid at last year's rate?
And that was the one from Amanda, is that correct?
Correct, yes.
Okay, sorry, my phone had dropped off. Amanda, if you can go ahead and send an email in, we are probably gonna have to go ahead and look at all of those authorizations to see what rates we have in our system. Normally, if we are paying a specific rate, it's pulling off of a prior authorization. So, you know, if there might be a disconnect between the claim system and the authorizations that you guys are seeing, sometimes we have to align those systems, but we would have to review like the specific claims to actually see what the issue is.
Perfect. And I think, Amanda, you have our information to submit that to. Is that correct, Amanda?
Yeah, I'll do that. Thank you.
Thank you very much for the question. I appreciate it. And Luann, I'm not sure which question you are responding to. It looks like you put in here, request an updated auth from IME. If you wanted to unmute yourself and respond to your question, I'm not sure, is that a question or is that a statement or?
Hi, I was just trying to help answer her question. IME requires with the rate changes that you go out and get it updated auth with the new rate on there effective 7/1, and then they'll pay the claims correctly.
Well, I appreciate that. That's very helpful. Thank you.
Yep.
Yeah, nice. All right. And I do see that Robin has put out there the information about the provider experience rep. We do have a question in here regarding when will the fiscal year 23 rates be posted for home health LUPA rates. Do we have anybody from the policy team on here with IME or someone that can answer that question regarding the fiscal year 23 rates for home health LUPA rates? And if not, that would be one that we would be able to go back and get that information from our policy team as well. So it looks like Heidi Thompson just posted a question. In the IME program integrity discussion, there was mention that CMS posts findings. Do you have a specific link to access that information? I would go back out to our website, and if you cannot find it on our website through the program integrity selection in there, then I would suggest getting a hold of program integrity, and their contact information is actually listed on our website as well. So that may help you. And if you had additional questions for the program integrity team, that would be a great segue into those questions as well. Hopefully that does help you, Heidi. And Mike has just posted out here again, everyone, the link for the program integrity team. So he did put that a link in there for us. So I appreciate that. Thanks, Mike. Okay, scrolling back up here. I don't know if there's anyone on our IME team here that is related to home health agencies, but looks like we have a question. Is everyone who is a home health agency required to do a cost report? I don't know, Desiree, are you able to answer that question?
Can you say the question again? I'm sorry, I was multitasking.
No worries. Is everyone who is a home health agency required to do a cost report?
I would need to check on that.
Okay, all right. So that's one that we will get back to you on. So I appreciate that. Thank you.
Yep.
And I believe that AmeriGroup and Iowa Total Care have addressed this question from Linda B. If there is an issue with one of the MCOs, who do providers contact at Iowa Medicaid? So here at Iowa Medicaid, we do have Bianca Finley that does the provider liaison between the MCOs and Iowa Medicaid. And I didn't know if Bianca, if you were on today, if you wanted to introduce yourself. She might not be on today, but let me go ahead and put her email address in here. She is the liaison. So if you've tried to reach out to the MCO and you've tried to reach out to your provider representative from that MCO and are still struggling with that communication in that way, shape, or form, Bianca would be a good resource for you. Let me get that typed in here. So hopefully that would answer your question for if you've tried working with the MCO. And I do know that Iowa Total Care and AmeriGroup, I'm not sure if Molina will, but they do have that map that's out there. And then on the map, there may be a manager that's listed on that map. AmeriGroup, do you have a manager listed on that map that you have? Julie?
We don't have our map on our website anymore. We just use the contact us feature. But again, my email address is in the chat. I can put it in there again too, just so it's at the top.
Right, because it is hard for everybody to scroll through and get that information. So I appreciate that. Thank you. How about Iowa Total Care on your map? Do you have like someone that's above the provider representative? If they've tried to work with that provider representative and for whatever reason it's not working, is there like a hierarchy of contacts that they can use within Iowa Total Care before they reach out to our provider liaison, Bianca Finley.
Good morning, Maria. It's Paige Pettit. There is contact information for all of the management, for the PR leadership. So absolutely, if there are anything that needs to be brought to leadership attention, our contact information is also located with the map.
Perfect, thank you. I appreciate that. All right. And it looks like Stacy has put out here some links from Molina Healthcare as well. And Julie has re-put her information out there. And as she stated, there is a contact us link, and Paige has described how to go through that process with Iowa Total Care. Just trying to see if there's any other more generic questions that we might have and be able to address while we're here today.
Maria, this is Stacey Harris from Molina Healthcare. Can you hear me okay?
I can.
Okay, really quick, relative to the territory maps. Yes, Molina Healthcare of Iowa will definitely be submitting online via our public website and our provider orientations. Very similar to what Iowa Total Care has with the hierarchies, as well as several territory maps with contact information by region.
Very nice. Thank you for chiming in on that, Stacy. Appreciate it.
Welcome.
It looks like we do have a question for AmeriGroup. This is from, if you're looking in the chat box, 684109, and to the left, it's number 6. It says, in the AmeriGroup auth lookup tool, K0001 states that it does not require an auth unless it is a rental. We submit the auth as a rental, and then it comes back denied as no auth needed. What information should we be following? Anybody from AmeriGroup able to address that? It maybe is a generic question if folks do get a similar response.
Yeah, Maria, this is Julie. I was just kind of confirming too. I think I would have them reach out to the provider experience rep. I don't want to misspeak, and I know sometimes we have a disconnect between the Pluto tool. So I can't speak for the group, sorry, today, but if that individual would reach out to one of us, we can explore that further.
Okay, thank you for that. I appreciate it. And for the providers that are posting questions out there, I know we do say a lot, please refer back to your provider representative from the MCO, or please email us those specific questions. But I feel that you would probably prefer the correct answer the first time, and gathering that information on the question that you're asking, getting more of those details would be important to getting you the right answer the first time as quickly as possible. So again, I know you hear that a lot. Well, we'll get back to you on that, or please contact your provider representative. I understand that concept, but again, I feel like we all would prefer to have the correct answer the first time. And there's usually more details behind the short questions that are posed on here as I'm looking through these as well. So please bear with us on that. I'm just scrolling here. So there's, I think, Bonnie, I'm not sure if we've answered this or not. You'd asked, and I'm not sure where your question started at, but you said something about it did not answer your question on our community-based case manager will monitor members in accordance with contract visits and inform members of their right to return to the community. If you could just give me a quick synopsis of what you're referencing there, I would greatly appreciate it. And that way we may be able to answer that more quickly for you. And go ahead and take yourself off of mute, Bonnie. Well, if Bonnie, you are able to answer that question, you can take yourself off of mute at any time as well to get that question answered. But otherwise, we will be looking forward to getting some answers back for you as we go through your original question, how it was answered, and then finally your a question in return to that, because it doesn't appear that we've answered the question.
Maria, sorry, Maria, for interrupting. This is Julie. We did. We answered it lower down in the chat. So.
Okay, that sounds good. Great, thank you. And as you can imagine, it's probably hard to catch up. I do see 4 more messages here. So T. Wilson, will ITC be updating their remits to include a list of claims recoupments are being applied to? So anyone from Iowa Total Care, that was the last question in the chat from T. Wilson.
Maria, this is Janie Larson. How are you?
Good. How are you?
I'm doing well. Thank you. That is some information that we have taken back to our corporate partners, and we are in the midst of looking at revisions for our explanation of benefits as it relates to our recoupments and explanation of benefits. So I don't have an exact answer for you, but I can tell you that that information has been shared with our corporate partners and is on the list for possible changes. So we appreciate the fact that it is still on the front burner for many providers. So thank you.
Great, that sounds good. Thank you for that response to Randy. Information about member can be viewed on the provider portal under eligibility. And then, of course, any follow-up questions that you might have for that. And then we did receive a response. Here is the link to the elves. So the link to the elves came from Tuwera out here on our chat box here. Okay. Through here. Okay. Now, we have about 10 minutes left, and if you have any questions that you feel would be beneficial for the entire group to hear that question, I would encourage you to go ahead and put that in the chat right now, whether it's Iowa Total Care, AmeriGroup, Molina Healthcare, or Iowa Medicaid. So if you have anything that has not been answered already or addressed already that you feel would be beneficial for us to include in our question and answer session, could you please go ahead and put that in there now? So it looks like we have Jen. We are a home health agency and we have to do cost report around May or June every year. And that must have been from Jen, a different question that was posed. Jen, are you able to take yourself off of mute?
Hi.
Hi.
I just know that somebody earlier had asked about that. And our agency, we have to do it every year. We have to do cost report every year. I know that somebody, I just saw it, or I heard you read it earlier, that somebody had asked about it for a home health agency. I'm trying to scroll. There's so many questions.
Right,
I'm trying to find it. That somebody asked if a home health agency have to do it, and we do it every year.
And that's good that we actually got your response verbally as well. So just in case that was the person that put that question out there, and that way that they wouldn't have to scroll through to find that answer on that. So Jen, you along with all of our other providers have a plethora of information that you have stored and little tricks of the trade that you've used, and just a lot of knowledge. So I really appreciate that you responded back to that, as well as others that have responded from provider to provider. So thank you.
You're welcome.
I'd like to piggyback on Jen. I suspect that because the reporting is due in May, that may be their Medicare reporting versus Medicaid cost reporting, which is typically due by September. But many of the rates for Medicaid are built from the Medicare rates. So for the original question, the provider should go to Chapter 79 of the Iowa Administrative Code and look up the specific service, because it will identify the basis for the rate. And it will identify whether it's a cost report or if it's a Medicare cost reporting rate, without knowing the specific service they have a question on. I would recommend Administrative Codes 79, Chapter 79.
Okay, thank you, Linda. I appreciate that. For whomever asked that question, thank you to Jen and Linda for that response. And Linda, the more details that you provided from Jen's response was very, very beneficial as well. So thank you for that. It does look like Luann put out here, align timely filing deadlines with IME policy. Seems like each MCO has their own timely filing deadlines for claims. Is this correct? And for anybody on any one of those teams, I'll answer, but if I'm incorrect in any way, please correct me. But IME does have our own policy regarding timely filing, as well as each MCO. And this is something that could be looked at from Iowa Medicaid with our MCOs, as you brought it up as a question. So this is certainly something that we can take back to our team here for our claims team or our policy team to take a look at and work with the MCOs on. I'm not sure if it's possible to change those at this point, but it certainly would be worth the time, energy, and effort to take a look at that. So Luann, thank you for posing that question. And it looks like A. Lawrence, I don't know what Molina's plans are for IDs, but it would be nice if they would just use the Iowa Medicaid ID, 7 numbers and a letter, instead of creating a whole new one like AmeriGroup and AmeriHealth did. Just a suggestion to make it easier for providers. Again, in our town halls, as well as what we're doing today, we want to hear your questions like that, comments, suggestions. As I stated in our training yesterday, you are the end users. You have the experience of being hands-on with the end result of trying to bill an MCO and an Iowa Medicaid and some of those nuances as well. So over the last few years, we have actually gotten better and better about, listening to you and changing the way that we address problems and issues and things like that, because who better than those end users? And I believe Julie stated that there are some opportunities to be in some of those trials and things like that. So we do encourage you to, if you do receive an IL outlining some of those things, we would encourage you to sign up for it if at all possible. Again, because you do come with the experience of being out in the field and being in the front lines, if you will, and taking on some of these challenges that we're presented with. So your comments in here are greatly appreciated. And again, you can have that same opportunity during our town halls on a monthly basis. All right, well, I am going to go ahead and end this session today. We did have a rocky start and I do apologize for that, but I wanted to let you know that we're doing our very, very best to provide you with the most updated information and a wide variety of information, because we have a wide variety of providers throughout the state of Iowa that are providing amazing services to our members. Again, please send any information that you have, any questions that you have. We'll get this posted out there. You'll be able to screenshot it, print it, listen to it, review it when all of these trainings are done. If you can give us a couple of weeks after the training to make sure that we get all of the questions and answers. Again, targeted specific questions if you want an immediate answer. Hopefully we've given you those resources. We appreciate your time today. Thank you and have a beautiful, beautiful day.
Thanks, Maria.